right, we're on the record at 10 a.m. on April 14th, 2021. This is the Zoom recording of Mary Teresa Allen. The court reporter is Bonnie Smith. Before we proceed, I will ask counsel to agree on the record that there is no objection to this deposition officer administering a binding oath to the witness remotely. Please state your agreement on the record, beginning with plaintiff's counsel.
No objection from the plaintiff.
Agreed.
No objection.
All right, Ms. Allen, would you raise your right hand? Do you swear the testimony you're about to give in this cause to be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Thank you.
Morning, Miss Allen.
Hi there.
Would you state and spell your full name, please, ma'am?
Mary Teresa Allen. MaryTeresa Allen.
And where are you employed now?
Bridgeway Hospice
Okay. And where is Bridgeway Hospice?
in Athens,
That's
Georgia.
fine. And you're a registered nurse.
Yes,
You've been a registered nurse since when?
2006.
And you're aware that there's a code of ethics for registered nurses,
Yes,
and you comply with that code of ethics
yes,
as a registered nurse.
yes.
And you're a member of ANA, the American Nursing Association. If you know.
No, I don't believe I am.
All right. Do you have a copy of the ANA Code of Ethics for nurses?
Not in front of me, no.
Thank you. And thank you. I'll do a little better job of my question. Have you ever had a copy of the ANA Nursing Code of Ethics?
I don't recall.
All right. Well, in June of 2017, you were employed by Homestead Hospice
Yes,
as a registered nurse.
yes,
And one of your patients was Shirley Couch.
yes,
And since Shirley Couch was one of your patients, you had a duty to her.
Objection to the extent it calls for a legal conclusion. Subject to that objection, you can answer. You can answer, Ms. Allen.
yes,
Yes, and one of those duties as Shirley Couch's registered nurse in June of 2017 was to act as her patient advocate.
Same objection. You can answer.
yes,
And in other words, you're required by the Code of Ethics to advocate on behalf of your patients.
Objection foundation. You can answer.
yes,
And Shirley Couch was one of your patients.
yes,
And in June of 2017, you were required to advocate for her.
Objection foundation. You can answer.
yes,
As her nurse.
as her nurse, yes,
Yes, ma'am. And these are, I mean, this doesn't sound foreign to you. This is basic nursing, right? A basic nursing concept that you're a patient advocate. You advocate on behalf of your patients as a nurse.
yes,
And if at any time my questions don't make a lot of sense, which can happen, or you don't understand the question, anything like that, just let me know and I'll re-ask the question. I want to make sure that you understand the question and that I'm asking a good question as we go along. All right.
okay,
And another thing that we all do, I know I do it, is I say and it's the way we converse or talk. And it's very difficult for the court reporter to take that down. So if instead of yes or no, or whatever you intend to say, you say, I may stop and and ask you to rephrase that, just so we can get a clean record.
Okay.
All right. And you've been a licensed nurse since when?
2006.
Yes, ma'am. And where did you do your nursing training?
Athens Technical College.
And when was that?
2005, 2006.
Yes, ma'am. And where did you go to school before Athens Technical College to get your RN?
Georgia Perimeter,
Yes, ma'am. And what did you study at Georgia Perimeter?
associate degree of nursing.
And when did you attend Georgia Perimeter?
2002 to 2005.
Yes, ma'am. And Georgia Perimeter, that's Georgia Perimeter College, right?
Correct.
And what about before Georgia Perimeter College?
Clayton State College in 1980.
And what did you do from 1980 to 2002?
A number of things. I was secretarial, accounting,
Yes, ma'am.
cosmetologist. Had our own business, a service station and convenience store.
And where was that?
When?
Ma'am?
1990 to 1999.
Where was that?
Battle Creek, Amoco,
What town is that?
Jonesboro, Georgia.
Got it. All right. What else?
Substitute teacher,
Yes, ma'am.
housewife and mother.
Yes, ma'am. And what did you study at Clayton State Community College?
General courses.
Yes, ma'am. And when did, what made you decide to want to go back and become a nurse?
I was laid off after 9/11 and when I went to the unemployment office, they had programs to help retrain people that had been laid off.
All right.
And I was tested and went into the nursing.
All right. And you were employed by Homestead Hospice on May 8th, 2016,
Yes,
and you were a full-time employee at Homestead Hospice the entirety of June 2017,
yes,
when Shirley Couch was your patient.
yes,
And you resigned from Homestead Hospice on March 15th, 2018.
yes.
And that was, why did you resign from Homestead Hospice in March of 2018?
To seek other areas of hospice. I became an admission nurse.
Yes, ma'am. Why did you want to seek other areas as a hospice nurse in March of 2018?
I was approached about an opportunity.
All right. By who?
A friend that worked at this other hospice.
Yes, ma'am. And what made you make the change from Homestead Hospice to the other hospice?
There was more money and a different avenue of nursing.
Okay. And how are the avenues of nursing difference between Homestead Hospice and your new hospice?
It was a position where you only did admissions.
Okay. Now, in June of 27, Renee Bonner was also employed by Homestead Hospice.
When?
Renee Bonner was also employed by Homestead Hospice in June 2017.
Yes.
She was employed there at Homestead Hospice in June 2017.
Yes, she was.
Have you spoke with anyone about this case before your deposition here today, other than your lawyer?
No,
You spoke with anyone about your deposition?
no.
Have you reviewed any documents in preparation for your deposition here today?
With my attorney.
Yes, ma'am. What documents did you review?
Objection to the extent that it calls for any attorney-client privilege, subject to that exception. You can answer the question.
And I don't want you to share any conversations you had with your lawyer, just what documents that you reviewed.
My nursing notes.
Yes, ma'am. What
And
else?
I'm sorry.
Yes, ma'am. What else?
Let's see. It was nursing notes and a piece of paper
What was a piece of paper?
that had times on it.
Was that part of the medical record?
Yes.
Was that
Yes, it was.
the vitals? You remember what that document was called? What part of the medical record?
Well, it was a piece of paper that had writing on it. It was,
Yes, ma'am.
so I don't know if it was a part of the medical record or it's a part of this record. Not necessarily.
Oh, the drugs. It was part of the GBI investigation with the drugs that were administered by Renee Bonner in handwriting.
It was,
Object to the characterization, but go ahead. You can answer.
it was a handwritten piece of paper with times and things on it. Yes.
Well, and those things included the drugs.
It included numbers,
Yes, ma'am.
words.
Yes, ma'am. And the numbers included 0.25.
Objection, you're asking her about a document that she's not looking at right now. So that's objection to the extent that that's vague. Your question is vague.
You may answer.
It had a bunch of numbers. I don't recall.
You don't recall any of the numbers?
Not without it in front of me. No.
You don't recall any of the writing?
No.
Yeah, we'll get to that document. Any other documents?
That was it.
When was the last time you spoke with Renee Bonner?
I don't know exactly.
As best as you can remember. What was that?
I'm sorry.
I thought I heard someone else. That's okay. So, as best as you can remember, when was the last time you spoke with her?
Probably one day last week.
Okay. Remember what day of the week that was?
Do not.
Was that on your mobile number?
Yes.
About how long did you talk?
I don't recall. 5 minutes. I don't know.
Tell me everything that was said in that conversation.
Object to the extent that it calls for any attorney-client privileged information. Subject to that objection, you can answer, Ms. Allen.
I don't recall. We talk. I check on her to make sure she's okay.
Yes, ma'am.
Recall conversations, exact word for word. So it was.
Yes, ma'am. And my question wasn't word for word, and I didn't use the phrase word for word. I want you to tell me everything you remember about the conversation that was, 5 to 10 minutes. Along with
Same,
Renee Bonner just last week. What's that?
same objection. You can answer, Ms. Allen.
I don't recall what the conversation was.
Did you call her or did she call you?
I do not recall that either.
That'll be in your phone records, though, right?
Yes.
And did you speak with her before or after you met with your lawyer regarding this deposition?
It had to have been before, because I just spoke with Felicia this week.
You don't have to tell him when we talked or what we talked about, Ms. Allen.
Okay.
All right. And before last week, when was the last time before that you spoke with Renee Bonner?
I don't recall.
All right. And what's Renee Bonner's mobile telephone number?
I would have to look it up.
Okay. You can. And how often do you talk with Renee Bonner?
I'll occasionally, I don't know, once or twice a month. I
Okay.
don't recall exact numbers.
Okay. Now, you spoke with the GBI regarding Renee Bonner.
I spoke with the GBI, yes.
Yes, ma'am. And everything you told them was true.
Yes.
You wouldn't lie to a federal or state agency. True.
No, I would not.
You know that would be a crime. So of course you would not do that. Right.
Objection calls for legal conclusion. You can answer.
Let me answer.
No, I would not lie to the GBI.
Okay. So everything you told Special Agent Hartzog was the truth.
Yes, it was.
I'll show you what we'll mark as Exhibit 1 to your deposition. Have you ever seen this document before?
No, I've not.
This is the Exhibit 1 to your deposition is the Georgia Bureau of Investigation Region 11 Investigative Summary, which is Exhibit 4 to the GBI report regarding Carol Renee Bonner.
Okay.
And it reads in part that Agent Hartzog reviewed Bonner's criminal history record. Bonner was arrested in Georgia 36 times. Were you aware before today that Renee Bonner had been arrested 36 times?
Objection foundation calls for speculation. You can answer, Ms. Allen.
No.
Between 1982 and 2000, Bonner was arrested for deposit account bad checks 32 times. Were you aware of that before today?
No.
Objection foundation calls for speculation.
In 1985, Bonner was arrested for theft by taking, as well as criminal trespass and terroristic threats. Were you aware of that before today?
Objection foundation calls for speculation.
You may answer.
No.
In 1994, Bonner was arrested for financial transaction card fraud. Were you aware of that before today?
Objection foundation calls for speculation.
No.
Did Renee Bonner ever share with you that she'd been arrested?
Only since all of this has gone on.
Yes, ma'am. And by all this, you mean when she was charged with attempted murder and elder abuse regarding Shirley Couch?
Since that started, yes.
Yes, ma'am. Did you testify at the criminal trial?
I did.
All right. And what day did you testify?
I do not recall.
Do you remember who called you?
No, it was there. We were there for 2 weeks. I don't know.
Yes, ma'am. Were you aware that Renee Bonner was convicted?
Objection calls for speculation.
Convicted of, was it attempted murder and elder abuse? Is that your understanding?
Same objection. You can answer.
That is my understanding.
And do you agree with that verdict?
Objection calls for a legal conclusion from a lay witness.
You may answer.
No, I do not.
And that's because you think Renee Bonner administered medications in accordance with Homestead Hospice practice?
Objection foundation speculative.
You may answer.
Yes, she,
And she also administered medications to Shirley Couch in accordance with Dr. James Michael Shiver's orders.
yes, But it-
And she also administered drugs to Shirley Couch in accordance with the training that she was provided by the Homestead Hospice nurses in June of 2017.
Objection foundation speculation calls for speculation. You can
You
answer.
may answer.
as far as I know,
Yes, ma'am. And you were one of the nurses that trained Renee Bonner in the administration of the drugs to Shirley Couch.
yes,
And what you had to train her regarding was the dosage,
yes,
what drugs to administer and when,
yes,
the adverse side effects to look out for,
yes,
and communicating those adverse side effects to you, one of your fellow nurses, or Dr. Shiver,
yes,
and the potential adverse side effects of the drugs that she was administering,
yes,
and the proper documentation of the drugs that she was administering.
Objection to the extent that it calls for something that is not legally required in hospice. Subject to that objection, you can answer.
You may answer.
no,
You didn't, have you ever heard the phrase "not documented" means not done?
yes, I've heard that.
All right. And you learned that in your nursing training,
Yes,
also in your nursing teaching. Yes.
yes,
Nursing school. Yes.
yes,
And you understand that it's important to document.
Objection foundation calls for speculation.
yes, you can document.
Well, you're actually required to document your patient care.
I am as an RN.
Yes,
Renee,
ma'am. Go ahead, Renee.
family members are not required to document. No,
They don't have to document the medication that was administered.
they don't
No.
have to. No.
Okay. And the reason it's important for you as a nurse to document your patient care is because you won't always be there.
Objection to objection to the extent of the question always be there is vague.
You may answer.
What is the question again?
Would you read it back, please, Madam Court Reporter?
question, okay, and the reason it's important for you as a nurse to document your patient care is because you won't always be there.
Well, nobody can document my patient care if I'm not there.
Yes, ma'am. That wasn't my question.
Okay,
You-
well,
Go ahead.
you need to, I guess, ask it again or ask it a different way. I don't understand your question.
All right. You went to nursing school. Yes?
Yes,
And you also trained after nursing school.
yes,
And that training was to become a nurse
yes,
and be an advocate for your patients
yes,
and follow the nursing code of conduct
yes.
when caring for your patients.
Mhm.
Yes?
Yes.
And also follow the, appropriate standards of care for nurses when you care for your patients.
Objection calls for a legal conclusion on standard of care. Subject to that objection, you can answer.
Yes,
And when you care for a patient, you can't care for a patient 24 hours a day, 7 days a week. True?
true,
That's not humanly possible, right?
true,
So one of the reasons that you have to document your patient and your patient care is so that nurses and physicians that follow you can see what happened when they weren't there, right?
right,
And also so that when you follow other nurses and physicians, you can see what happened when you weren't there.
correct,
And that's important for what's called a continuity of care, right?
correct,
If you didn't have any idea what happened when you weren't there, it would be difficult for you to safely care for your patient.
Objection to the extent that it calls for legal conclusions regarding safe care. Subject to that, you can answer.
You may answer.
yes,
And one of the things that you document as a nurse is drugs that are administered to your patient.
I document what I'm told has gone on. There is not a legal document for charting medications when I'm not there. But I ask the family, what have they had? So that we know that they're either remaining comfortable or they need more medication or they don't need more medication.
All right. You said there's not a quote legal document for charting medications. What is a legal document for charting medications?
Objection to the extent that it calls for a legal conclusion. Subject to that, you can answer, Ms. Allen.
In the hospital, there is what's called a MAR, medication administration record. In a
Yes, ma'am.
hospital, in a hospital setting.
Right.
In a home setting, there is not that document.
Okay. You're saying in a homestead, a hospice setting, there is no medication administration record. True?
Not in the home, no.
Now, you agree it's still important to know what your patient has had as far as medications,
Yes.
as far as drugs.
Yes,
And the reason that's important is so that you can determine whether your patient is receiving a safe amount of drugs.
Objection to the extent that it calls for a pharmacological opinion. Subject to that objection, you can answer.
yes,
And you agree that your patient's safety is of paramount importance.
Objection to the extent that it's calling for the wrong legal conclusion, legal standard of care. Subject to that, you can answer.
To the best of my ability.
Yes, ma'am. Absolutely. And you also need to know that's particularly true when a patient is being given potentially dangerous drugs.
Objection. Vague to the term dangerous drugs. You can answer the question.
Yes.
All right. And you agree that morphine is a potentially dangerous drug?
Objection form, you can answer.
Same
All-
objection.
All drugs are potentially dangerous.
Yes, ma'am. Some are more dangerous than others.
Objection calls for speculation, calls for a pharmacological opinion from a person who's not a pharmacist. You can answer.
Same objection.
From what I understand, yes.
I'm going to show you what we'll mark as Exhibit 2 to your deposition. Have you ever seen this photograph before?
Objection to the exhibit foundation. You can answer.
Yes.
All right. When did you last see it?
Objection to the extent that it calls for information discussed during attorney-client privileged communication.
Monday.
All right. Had you ever seen it before Monday?
No.
So when I asked you whether you'd reviewed any documents in preparation for your deposition here today, you didn't mention this. Why is that?
I didn't recall it.
All right. And now you recall it.
Yes.
And you're familiar with the Drug Enforcement Agency,
I am.
the federal agency,
I am.
also referred to as the DEA.
Yes.
And in your education and training to become a registered nurse, you also learned about drugs
Yes.
and how to properly administer drugs to a patient.
Yes.
You learned about adverse side effects of drugs.
Yes.
And you also learned that because a physician wasn't always there, you had to be the eyes and ears of the physician when you administered drugs to a patient.
Yes.
And in order to administer drugs to a patient safely, you have to know what the drug is.
Yes.
You have to know what it's used for.
Yes.
You have to know the proper dosage.
Yes.
You also have to know the adverse effects of the drugs, the potential adverse effects.
Yes.
And this photograph depicts, relative to a 2012 Lincoln Head penny, the amount of fentanyl that's potentially lethal to an opioid naive patient.
Objection. Foundation calls for speculation, vague term, opioid naive patient.
Join.
You
I-
agree? I wasn't finished. Yeah. Do you agree with that representation by the Drug Enforcement Administration?
Objection calls for speculation.
You may answer.
I don't know what that is. I do not agree with anything.
Okay. You know Dr. Ken Park?
No, I do not.
Have you ever heard of Dr. Ken Park?
I've heard of him.
All right. You understand that he's a physician?
Yes.
And your understanding, is he a well-trained and competent physician?
I don't know him.
Objection calls
ma'am.
for legal opinion and regarding a specialty that is outside of this witness's scope of expertise. She is a registered nurse.
Would you read back my question, please, Madam Court Reporter?
In your understanding, is he a well-trained and competent physician?
Same objection.
You may answer.
I don't know. I don't know him.
Yes, ma'am. And my question wasn't whether you know him. My question was whether you understand him to be a competent physician.
Same objection.
I don't know anything about the man. I know he's a doctor. I would assume he is competent if he has a medical license. And
Yes,
approved.
ma'am. Have you ever heard anything in the community that suggested he's not a well-trained and competent physician?
No,
All right. Have you ever heard anything in the community that suggests he is a well-trained and competent physician?
I haven't heard anything either way.
All right. So there's no reason for you to believe, based on what you've learned about him, that he's anything but well-trained and a competent physician. True?
Objection mischaracterizes the witness's testimony.
You may answer.
You can answer the question again.
Yes.
I'll show you what has been marked as Exhibit 3 to your deposition. Have you ever seen that before?
No.
Objection to the exhibit in and of itself lacks foundation, calls for speculation on the part of the witness.
No, never seen it.
Do you know what carfentanil is?
Nope.
Do you know what heroin is?
Heard of it.
What is heroin?
It's a drug.
Yes, ma'am. Can you tell me anything about it other than it's a drug?
No, I can't.
All right. Do you know what fentanyl is?
Yes.
It's a drug also.
Yes.
What can you tell me about fentanyl other than it's a drug?
It's used for pain.
Yes, ma'am. What else?
That's all I know.
Tell me everything you know about fentanyl.
Objection asked and answered. You can answer one more time.
It's used for pain.
Yes, ma'am. That's it.
That's all I know about it.
All right. What are the adverse effects of fentanyl?
Objection to the extent that it calls for a pharmacological opinion or a medical opinion. Subject to that objection, you can answer, Ms. Allen.
And if you don't know, that's fine.
Join.
Well, it can cause increased sedation.
Yes, ma'am. What else?
Without looking at my resources, I don't know.
All right. Now, this photograph depicts, according to the Drug Enforcement Agency, lethal doses of fentanyl and carfentanil relative to a lethal dose of heroin. Do you see that?
Same objection. You can answer.
I'm reading what you have in front of me.
Yes, ma'am. That's the way it reads, right?
That's the way it reads.
Yes, ma'am. And down here on the bottom, it's got 3 bottles. Can you see those?
Yes.
And underneath the bottles from left to right is heroin, carfentanil, and fentanyl. Do you see that?
Objection. Foundation calls for speculation.
You may
You can
answer.
I see it, but I don't know what this is.
Yes,
I don't-
ma'am.
The picture.
Go ahead.
This is a picture. I don't know what's in there. I don't know what that is.
All right. Well, I'll try again. This is a photograph put out by a federal agency called the Drug Enforcement Agency, which is abbreviated here and by the Drug Enforcement Agency as a DEA. You're familiar with that agency?
Correct.
Yes?
Yes.
And it shows, as it reads here, lethal doses of fentanyl and carfentanil relative to a lethal dose of heroin. Do you see that?
I see it.
Yes, ma'am. And my question is, does this comport with your education, training, and experience that a lethal dose of fentanyl relative to a lethal dose of heroin?
I have not.
Objection. Foundation calls for speculation, calls for pharmacological opinions, which this witness is not qualified to give. Subject to those objections, you can provide your answer. Ms. Allen.
Join,
No, I have not had training on that. I don't know what that is.
Yes, ma'am. So it's safe to say you have absolutely no idea what the lethal dose of fentanyl relative to a lethal dose of heroin is. True?
That would be correct.
I'm going to show you what we'll mark as Exhibit 4 to your deposition. Have you ever seen that photograph before?
I'm not seeing the photograph. No,
Okay, you recognize this to be Miss Couch?
I do.
And does that, I think the first time you saw her was on June 23rd, 2017?
I don't recall the exact date, but that sounds correct.
Yes, ma'am. And is this what she looked like on June 23rd, 2017?
No,
Okay. How did she not look like this?
well, she was crying out in pain. She was restless. She was tossing and turning in bed. She was not sitting up eating or whatever. I don't know if she's eating, but she wasn't sitting up, just sitting there like that.
Said she was crying out in pain when you first saw her on the 23rd of June, 2017?
Yes. Yes.
She was also restless? Yes.
Yes.
She was also turning in her bed?
Yes.
I'd like to show you what's been previously marked as Exhibit 6, your deposition. Is that right, Madam Court Reporter?
I thought we were on 4.
Okay. Liz?
Actually, we're on 5. The last one was 4.
Okay, I want to make sure I have this right, though. We've got Renee Bonner's criminal history as 1. The 2 DEA photographs of fentanyl as 2 and 3. And then the first photograph of Miss Couch 4, and this would be 5, is that right?
Correct.
Right, thank you. You see that photograph?
Yes.
And does this photograph accurately depict what Renee Bonner looked like the last time you saw her on the 25th of June, 2017?
Objection. I think you mean to say Shirley Couch, not Renee Bonner, but objection to the extent that it lacks foundation and calls for speculation.
I'm looking at Renee Bonner's, Shirley Couch's photo. Hold on, I've got Renee Bonner. Can you see what's been marked as, this is 5, Madam Court Reporter?
Correct.
which is a photograph of Shirley Couch.
Mhm.
Is that what Shirley Couch looked like the last time you saw her? That would have been on or about June 25th, 2017?
She was not sitting up.
Okay. She was lying down.
Yes.
What else?
I don't recall specifics. It was,
Yes, ma'am.
she was,
What you recall is that she was lying down.
yeah, because
That's
she
it.
was in bed. She was not sitting up. She was lying down.
All right. Do you recall whether she had that black left eye on the 25th, the last time you saw her?
I don't recall.
All right. All you recall is that she was lying down.
Yes.
When you were employed at Homestead Hospice, were you given a bonus? Any sort of signing bonus?
No.
All right. I'm going to show you what we'll mark as Exhibit 6 to your deposition. Have you ever seen this document before?
Yes.
And this is a portion of Shirley Couch's Homestead Hospice medical record for June 2017.
Mm-hmm.
Yes?
Yes.
I know we all do that, but and I'll
I'm sorry.
remind you along the way. That's all right. So, and this is a record of Shirley Couch's vital signs for June of 2017.
Yes.
And you've got some entries here. Can you see that okay? I can make that a little bit larger.
I can see it.
All right. It reads here,
Yeah, it's
Mary Allen. That's you, right?
me. Yes.
It's, you go by Teresa Allen, but I believe it's Mary Teresa Allen. Is that right?
Correct.
All right. So according to this vital signs for Shirley Couch for June of 2017, you cared for her on the 23rd, 24th, and twice on the 25th. Is that right?
Correct.
And does that comport with your recollection of how many times that you cared for Shirley Couch in June of 2017?
Yes, it does.
All right. And on your first visit on June 23rd, you took her temperature.
Mm-hmm.
Yes.
Correct. Yes.
And you also took her pulse.
Yes.
And you also measured her respirations.
Yes.
You also took her blood pressure.
Yes.
And you did that on each of those 4 visits. Is that right?
Yes.
And your measurements, what you recorded for your patient, that's accurately reflected here.
Yes.
I'd like to move on to page 2 of Exhibit 6, which is a verbal order. And this
Yes.
is an order that it looks like you took off. This is on the 24th. Is that right?
Yes.
And this is an order from Dr. James Shiver, MD.
Yes.
And the date of the order is June 24th, 2017 at 15:02 or 3 o'clock in the afternoon, right?
Yes.
That's for Shirley Couch.
Yes.
And the order is for morphine 0.25 to 1 milliliters by mouth every hour, PRN pain. SOB read back and confirmed. Start date 6/24/2017. Do you see that?
Yes.
And that's your note, right?
Yes.
And clinician signature, that's electronically signed by Mary Allen, RN. That's you.
Yes.
That's your electronic signature.
Yes.
And physician signature electronically signed by James M. Shiver, MD.
Yes.
And that's, if you look in the upper right corner, MR, that's the medical record number. Is that right?
Yes.
And this is actually also referred to as an EMR, or electronic medical record. Is that right?
Yes.
And that's how you sign an electronic medical record.
Yes.
All right. Then moving on to, this is your skilled nursing visit note, which is page 3 of exhibit 6. And this is a visit dated June 23rd, 2017.
Yes.
And this is, your time in is 8:30.
Excuse me, Mr. Potts, can you scroll down to the bottom so that she can make sure that this is her documented note and not some other nurse's note
Sure.
where it bears her signature?
You see that?
Thank
I
you.
don't.
I'm sorry, Mary, can,
I mean, I don't see the bottom of it, so.
You're talking about this right here. The bottom, it reads electronically signed by Mary Allen, RN, on 6/28/2017.
All right,
That's
I
you.
see it. I see it now.
Thank
Okay.
you.
And isn't that at the bottom of each page of the medical record? See that?
Mm-hmm.
Are
Yes.
you aware that that was on the bottom of each page? Okay. So we're all clear now what record this is, right?
Yes.
You see in the upper right corner, it says 1 of 4. That means this is a 4-page record.
Yes.
And this is page 1 of 4.
Yes.
And it's for Shirley Couch, your patient.
Yes.
And the date of your visit is 6/23/2017,
Yes.
June 23rd, 2017.
Yes.
Time in 8:30 that morning.
Yes.
1 hour administrative time, 2 hours travel time.
Yes.
Time out 10:30.
Yes.
And does that mean you were with your patient from 8:30 that morning until 10:30 that morning, or for 2 hours?
Yes.
And you took her vital signs. Make that
Yes.
a little larger. And she had a bit of a fever, right?
Yes.
Her temperature was 99.1 Fahrenheit, and temporal, that means it's an elevated as opposed to afebrile, or without a fever, right?
Temporal refers to where you took the temperature, her forehead.
And you agree that she had a fever.
Yes.
Pulse is 62 beats per minute.
Yes.
You've written strong, at rest, and irregular.
Yes.
And irregular means that her pulse is not regular.
That's correct.
All right. And an irregular pulse is a potential sign or symptom of a drug overdose.
Objection calls for a medical opinion, a pharmacological opinion, which is beyond the scope of this witness's level of expertise. Subject to
may
that
answer.
objection, you can answer.
Join.
No, it does not necessarily mean that.
Yes, ma'am. I didn't say it necessarily meant that. Would you read back my question, please, Madam Court Reporter?
Question, all right, and an irregular pulse is a potential sign of a symptom, sign or symptom of a drug overdose.
Same objection, you can answer.
I don't know.
Okay. And but anytime you don't know, just tell me you don't know. We'll move right along. Now, her pulse was 62, is that right?
Correct.
And apical, that's, again, where you took her pulse, how you checked it, right?
Correct.
And what does that mean?
At the apex of the heart.
Yes, ma'am. And a normal heart rate from
Go ahead.
from there is from what to what? What's the range?
60 to 100.
From what to what?
60 to 100.
Yes, ma'am. And then her blood pressure was 132/72.
Yes.
Her oxygen saturation was 98%.
Yes.
That was with oxygen though, right?
Correct.
Well, with oxygen, you mean she was being administered supplemental oxygen.
Correct.
And at what rate was she being administered supplemental oxygen? If
I
you
don't
know. All right. Now, you see, it goes on to read care plan documentation. This is your note, right? You input this entire note.
Yes.
It reads problem pain management, right?
Yes.
Intervention, administer analgesics as prescribed by MD.
Yes.
And an analgesic is what?
Pain. Something for
Yes,
pain.
ma'am. Including narcotics.
Yes.
Administration of analgesics, medication given morphine.
Correct.
Doses 0.5 milliliters.
Correct.
Root sublingual.
Correct.
So according to your note, she was given morphine, 0.5 or half a milliliter under her tongue.
Mhm. Yes.
Intervention, assess current pain management regimen, including effectiveness, relief measures, and side effects. That's what you wrote?
Yes.
Pain management. See relief measures.
Yes.
And do you see this HIS J0910C? What is that? If you know.
It's something to do with Medicare charting. It's something they follow on all the patients. It's called a HIS, HIS, a HIS. I don't know all the terminology, but
Yes, ma'am.
it's a
It's
Medicare measuring tool.
It's a code that you have to record to get paid by HMS, right?
Objection calls for speculation, you can answer.
I don't know that.
Okay. Relief measures diversion. And what did you mean by diversion?
Get her mind off of her pain.
Yes, ma'am. Narcotic analgesics, right?
That was the morphine.
And rest relaxation.
Correct.
And you see treatment and follow-up. This is a continuation of your note.
Correct.
Treatment initiated or modified. You see that? You answered yes.
Yes.
And did you mean it was initiated or modified?
It was modified.
Modified how?
It was to increase the opioids
Yes, ma'am. And the opioids were increased how?
from 0.25 to 5.
All right. Then it goes on to read, following treatment changes made, medication changes increase opioids. That's what you're referring to, right?
Yes.
And by the increase, you're talking about an increase from 0.25 to 0.5.
Yes.
And how often was that 0.5 milliliters of morphine to be administered?
She could have up to 1 ml every hour.
All right. And by ml, you mean milliliter, is that right?
Uh-huh. Yes.
And you communicated this to Renee Bonner.
Yes.
Renee Bonner was your friend then.
I worked with her.
Yes, ma'am. She was also your friend.
We were not friends prior to that. I mean, she worked at Homestead. I knew her that way. That was the only way I knew her.
Okay, so work colleagues then.
We were work colleagues. Yes.
Yes, ma'am. And she's your former work colleague and friend now.
She is.
Objection to the extent you're mischaracterizing the witness's testimony regarding the nature of the friend relationship. Subject to that objection, you can answer.
You may answer.
Yes.
It goes on to read, instruction provided regarding pain management causes aggravating factors. This instruction you gave to Renee Bonner. Yes?
Yes.
And if we move on to page 2 of 4 of your nursing note for Shirley Couch on June 23rd, 2017, caregiver instructed, and by caregiver, you mean Renee Bonner.
Correct.
The medications, when to take, caregiver instructed.
Yes.
And that again, by caregiver, you mean Renee Bonner.
Yes.
And by instructed, you mean when to administer the drugs to Shirley Couch.
Yes.
It goes on to read non-pharmacological relief measures, caregiver instructed.
Yes.
So in addition to instructing Renee Bonner on what drugs to give, how much to give, and when to give those, you also gave her instructions on non-drug relief measures.
Correct.
You also instructed her on positioning of the patient, your patient, Shirley Couch.
Correct.
You also instructed her on the side effects of the drugs that she was administering to Shirley Couch,
Correct.
including the adverse effects
Correct.
and potential adverse effects.
Correct.
And you instructed her to contact you or a nursing colleague or Dr. Shiver when there was an issue with those adverse effects.
Instructed her to call the office, which is our main number that would get whichever nurse is on call.
Yes, ma'am. Which would in turn get either you, one of your colleagues, or Dr. Shiver involved, right?
Correct.
And that's because you knew that Renee Bonner had no nursing or medical training. Yes.
Objection to the extent it implies that this person was required to have medical training to medicate her family member. Subject to that objection, you can answer.
Correct.
We're going to need to take a break, Mr. Potts, soon too. We're approaching the hour mark.
All right. We'll take a break and pick up here. How much time would you like?
5 minutes.
All right.
Going off the record at 11:06 a.m. We're back on the record at 11:13 a.m.
And Renee Bonner complied with the caregiver instructions that you gave her.
Objection to the objection, form objection. You can answer.
As far as I know.
Yes, ma'am. Well, when you were there the 23rd, 24th, and twice on the 25th of June, 2017. Yes.
Yes.
And if you'd seen Renee Bonner doing something that was not in compliance with the caregiver instructions that you'd given her, you would have, done something about that.
Correct.
And that's because you have a duty to your patient, Shirley Couch, as her patient advocate.
Objection to the extent that it calls for a legal conclusion from a lay witness. Subject to that objection, you can answer.
Yes.
And so Renee Bonner, to your knowledge, complied with your caregiver instructions regarding the drugs that she was administering.
Objection asked and answered. You can answer again.
Yes.
She also complied with your caregiver instructions regarding the potential adverse side effects of those drugs.
Objection calls for speculation.
Yes.
She also agreed and complied with your caregiver instructions regarding signs and symptoms to report.
Objection calls for speculation. You can answer.
Yes.
She also agreed with your caregiver instructions regarding what actions to take.
Objection calls for, sorry.
All right. What actions to take when she observed potential adverse effects of the drugs that she was administering.
Objection calls for speculation. You can answer.
Yes.
All right. Can you see that all right, Ms. Allen? We're still on the same exhibit, which I believe is Exhibit 6 to your deposition. This is page 204. And then you recorded what's called a FLACC. Is that a FLAC scale? Is that right?
Correct.
And a FLAC scale assesses a patient's level of pain. Is that right?
Correct.
And according to the FLAC scale, her face exhibited frequent or constant quivering chin, clenched jaw.
She had a clenched jaw. Correct.
Her legs were uneasy, restless, and tense.
Yes.
Her activity was squirming, shifting back and forth, tense.
Yes.
She moaned or whimpered,
Yes.
had occasional complaints of pain.
Yes.
She was difficult to console or comfort.
Yes.
Pain management included relief measures, narcotic analgesics.
Yes.
Treatment indicated bona fide, that's as you testified earlier, the increase in the opioids, the morphine.
Yes.
The instructions you provided regarding pain management were to Renee Bonner,
Yes.
as you previously outlined, and she complied with those.
Objection to the extent it calls for speculation. You can answer.
Yes.
Onto the next page, which is page 3 of 4 of your June 23rd, 2017 skilled nursing visit note for Shirley Couch. You see that?
Yes.
Under pain management, your note says, please refer to intervention documentation.
Yes.
And that's the documentation we just referred to, you just testified about.
I believe when I'm charting, I don't see all this. This is how the system we used would ask us questions and then it would put it in this form. So I don't normally see this.
Yes, ma'am. Because this is an electronic medical record, you input the information electronically.
Correct, but it's in a different format than what it's printing out.
Yes, ma'am. And this form is generated by your system.
By the answers that I give, yes.
Yes, ma'am. And still, all these answers that were generated in this report, based on the information you input, appears accurate. In other words, the information you input was accurate.
Yes.
Yes. Instruction provided regarding pain management. You see this intervention teach regarding medication to include dosages, administration, actions, side effects, possible interactions, and signs and symptoms to report to RN. Do you see that?
Yes.
And that's what you taught Renee Bonner.
Yes.
You taught her regarding the medications, the drugs that were administered to Shirley Couch,
Yes.
including the dosages,
Yes.
the administration,
Yes.
the actions of those drugs,
Yes.
the side effects of those drugs,
Yes.
possible interactions of the multiple drugs that were being given.
Yes.
Objection form.
And the S/S, that means signs and symptoms to report to the nurse.
Yes.
And she complied with your instructions.
Objection calls for speculation.
You may answer.
Yes.
Instructions providing regarding medications. Medications taught morphine, Valium. Is that right?
Yes.
And what type of drug is morphine?
Objection to
Opioid.
the extent that it calls for a pharmacological opinion or medical opinion. Subject to that, you can answer, Ms. Allen.
An opioid.
That's an opioid, right?
Correct.
What about Valium?
Same objection.
If you know.
Anti-anxiety med.
All right. And is there another name for Valium that you're aware of?
There is, but I don't recall what it is.
All right. Are there any potential adverse drug interactions with Valium and morphine? To your knowledge?
Objection to the extent that it calls for a medical opinion and pharmacological opinion. Subject to that, you can answer.
Yes, there can be.
And what are they?
Same
Over,
objection.
What?
over sedation,
All right. What else?
decreased respirations.
Yes, ma'am. What else?
That's the only two I'm aware of.
All right. And the actions, purpose, the actions and purposes of morphine and Valium,
Yes.
the adverse side effects,
Yes.
and the adverse side effects of morphine and Valium are what?
Over sedation, decreased respirations.
Anything else?
All I'm aware of.
All right. Dosages, route, and precautions. You gave Renee Bonner those instructions as well.
Yes.
She complied with those instructions.
Objection calls for speculation.
You may answer.
As far as I know.
Yeah. Well, if she didn't comply with them on the 23rd, 24th, or 25th, you were duty bound to report that. True?
Objection calls for a legal conclusion.
You may answer.
I'm only aware of what she did while I was there.
Yes, ma'am. And you were there on the 23rd, the 24th, and twice on the 25th.
Correct.
And based on your observations, Renee Bonner was complying with your caregiver instructions.
Yes.
Objection calls for speculation, asked and answered.
Your answer was yes?
Yes.
It goes on to read, these are the caregiver instructed, and where it reads caregiver instructed, you mean Renee Bonner.
Yes.
And you instructed her on the adverse side effects and reactions of the drugs,
Yes.
disposal of controlled substances, the drugs,
Yes.
dosage, route, and precautions regarding
Yes.
drugs, high-risk medications,
Yes.
and these are high-risk medications.
Objection to form. You can answer.
Join,
They can be. Yes.
The medication schedule
Yes.
of the drugs, yes.
Yes.
The caregiver response reads here, partial understanding, is that right?
Yes.
She understood, in your view, based on your education, experience, and training, enough to administer the drugs.
Yes.
And comply with your
Cause for
caregiver,
speculation.
and comply with your caregiver instructions.
Yes.
Objection calls for speculation.
Yes.
And action taken, teaching to continue. In other words, you continue to teach her,
Correct.
right? And she continued to comply with your instructions.
Objection asked and answered.
You may
Calls for
answer.
speculation.
Yes?
Yes.
See. Moving on down to the narrative notes. Do you see that?
Yes.
Would you like a moment to read that?
Yes. Okay.
All right. It reads, a patient, you mean Shirley Couch, had a rough night, not comfortable. Do you see that?
Yes.
She was instructed to give 0.5 milliliters now, and by 0.5 milliliters, you're talking about morphine,
Yes.
and a nurse would be en route to visit.
Correct.
And the nurse en route to visit was you.
Yes.
And upon arrival, the patient, Shirley Couch, was sitting in a high Fowler's position. What is that?
Sitting up in the bed.
Yes, ma'am. Head drooping down. That's what you wrote?
Yes.
Head drooping down is a potential sign or symptom of a drug overdose.
Objection calls for a medical opinion, calls for a pharmacological opinion.
You may answer.
It could be.
Yes, ma'am. Reports feeling confused. You see that?
Yes.
Confusion is also a potential sign or symptom of a drug overdose.
Same objection.
You may answer.
Yes, it is.
Daughter reports patient was up all night having difficulty swallowing. You see that?
Yes.
That's what you wrote. Yes.
Yes.
And difficulty swallowing is also a potential sign or symptom of a drug overdose.
Same objection.
You may answer.
Yes, but it's also a sign and symptom of transitioning.
Yes, ma'am. By transitioning, you mean dying.
Correct.
Well, and the way this works, you can't make a medical diagnosis, but you can perform what's called a nursing assessment. Yes?
Yes.
And when you take into account signs and symptoms, you take into account the entire constellation of signs and symptoms that the patient has.
Yes.
You also take into account the patient's history, do you not?
Yes.
Goes on to read getting choked on fluids when taking medicine. Did you see that?
Yes.
That's what you wrote.
Correct.
It's also a potential sign or symptom of a drug overdose.
Objection to the extent it calls for a medical opinion or pharmacological opinion.
You may answer.
No, I don't agree.
All right. Goes on to read, patient declines, yells out if she is moved or legs are touched, intermittent sharp pain to right chest area. Daughter reports giving only 0.3 milliliters, patient still moaning. You see that?
Yes.
Moaning is also a potential sign or symptom of a drug overdose.
Same objection.
You may answer.
No, I don't agree.
All right. And tell me, cite to me every text, treatise, nursing textbook, nursing paper, nursing article, anything like that that said a patient moaning is not a sign or symptom of a potential drug overdose.
Objection to form.
May I answer?
I don't have a quote. That's my personal opinion.
Okay. The patient, let's see, gave 0.5 milliliters with good results. Is that right?
Correct.
And is that you giving 0.5 milliliters of morphine to Shirley Cow?
Recall if I gave it or if Renee gave it, but it was given while I was there.
Yes, ma'am. And if you gave it, you were required by the nursing standard of care to record it. True?
Objection calls for a legal opinion.
You may answer.
That's what this documentation is.
What?
That's what I'm documenting here, that it was given.
All right. So this is, so then you did give it.
Objection mischaracterizes witness's testimony.
Again, I don't recall if I gave it or if she gave it, because we're constantly showing the family how to give it and watching them give it. So I do this all the time, so I don't recall.
Yes, ma'am. It reads here, though, patient still moaning, gave 0.5 milliliters with good results. That's what your note reads.
Correct. That within 15 minutes, she was fine. She was doing better. She was comfortable. She was
Well, it
getting
goes
relief with the increase in morphine.
within 15. Go ahead. I didn't mean to interrupt you. Thought you were
That was
finished.
it.
Oh, please. Were
I'm
you
done.
finished?
I'm
Okay.
done.
Goes on to read, patient is confused and calling out, Renee, Renee. That's what you wrote,
Correct.
which is also a potential sign or symptom of a drug overdose.
Objection calls for a medical opinion and a pharmacological opinion.
You may answer.
I don't know.
All right. When daughter leaves the room, discuss disease progression with daughter, Renee present, and daughter Paula via telephone. Explain patient may be having terminal agitation. Do you see that?
Correct.
And by terminal agitation, you mean that she's transitioning or dying.
I said, may be having.
Maybe having terminal agitation, right? Yes.
Yes, I said
Yeah.
correct.
And by terminal agitation, again, that's in the process of dying.
Yes.
And Terminal agitation, dying from what?
Objection calls for a medical opinion.
I don't know.
Okay. I mean, whenever you wrote in here transitioning, she was, by transitioning, you testified you meant dying. She was dying as a result of what?
Same objection.
Her disease progression.
What disease progression?
Well, she had heart failure or heart conditions. I mean, her, I don't know.
Okay.
They're hospice.
All right. Heart failure, anything else?
Heart failure is the only one I remember.
All right. Discuss disease progression. Has low-grade fever, difficulty swallowing. Again, difficulty swallowing is a potential sign or symptom of a drug overdose.
Objection calls for a medical opinion and pharmacological opinion.
You may answer.
I don't know.
All right. And increased pain and agitation. Verbalized understanding will continue to monitor.
Correct.
And
Correct.
this is, thank you. This is page 404. This is the end of your skilled nursing visit note for Shirley Couch on June 23rd, 2017 at 8:30 Eastern Daylight Time.
Correct.
If we go on, I'll show you, which is still portion of Exhibit 6. This is now your narrative note, date of visit, June 24th, 2017 at 1300 EDT. Do you see that?
Correct.
And that's June 24th, 2017. That's 1 o'clock in the afternoon.
Yes.
Administrative time, 30 minutes, travel time, 2 hours. Total time with the patient was what, 1300 to 1500 or 2 hours,
That's correct.
right? And again, you took her vital signs.
Yes.
And again, her pulse was irregular.
Correct.
That's what you wrote here,
Yes.
which is also a potential sign or symptom of a drug overdose.
Objection calls for medical opinion and pharmacological opinion.
You may answer.
I don't know.
All right. You took her respirations, her blood pressure, and her oxygen saturation, right?
Yes.
And her oxygen saturation was 91%. You see that?
Yes.
That was with supplemental oxygen, right?
Yes.
Oxygen saturation of 91% is not within normal limits. You agree?
I just,
Objection calls for a medical opinion.
You may answer.
anything above 90 is considered normal.
And that's with or without supplemental oxygen?
Correct.
All right. And give me a cite, textbook, treatise, medical text, nursing text, peer-reviewed articles, non-peer-reviewed articles, throwaways, any site for that.
I don't have it.
Objection to form.
Okay. Then we've got care plan documentation. A lot of this looked the same to me as your
Correct.
first note. And it would, so do you input the information again, or do you just, is there, can you have the software carry forward your notes from the previous input?
It was entered each time.
Yes, ma'am. So intervention, administer analgesics as prescribed by MD, it reads completed. Is that right?
Correct.
Does that indicate that you administered the analgesics?
It doesn't mean I did. One of the two, I mean, it's just saying that they were administered as prescribed by the doctor.
Okay. So it was either you or Renee Bonner.
Correct.
assess current pain management regimen, including effectiveness, relief measures, and side effects. Completed? Yes?
Correct.
You did
Yes,
that. You did that, right?
yes,
And pain management regimen includes the administration of the drugs that Shirley Couch was being administered. Yes?
Objection to the extent it mischaracterizes earlier testimony.
You may
Okay.
answer.
again, I don't know if I gave it or Renee gave it.
Yes, ma'am. My question was a little different though. Where your note reads, intervention, assess current pain management regimen, including effectiveness, relief measures, and side effects. It reads completed. Is that right?
Correct.
And her pain management, Shirley Couch's pain management included the administration of drugs.
I don't know. I have to read the note.
That's fine. Read it.
Well, show it to me.
Well, you're administering drugs for pain, right?
Objection to the extent it mischaracterizes the witness's previous testimony.
I need to see the note the narrative note will tell me what I did.
Oh, you mean at the bottom of this?
Correct.
Sure. All right, can you see that all right?
I can.
Now we're on page 2. Take your time and read that. Also, your lawyer's a copy of this too. If you guys, if you want to
Okay,
copy
we're
in
good.
front of you.
We're good so long as she can see what she needs to see to answer your questions. That's fine.
Right.
Okay, so yes, it was given while I was there.
The drugs were given to Shirley Couch while you were there.
Correct.
And you're talking about where it reads 0.5 milliliter of morphine administered at 1500?
Correct.
And that was you that administered that?
I don't recall.
All right, it was either you or Renee Bonner.
Correct.
Goes on to read no relief in 15 minutes. Repeated 0.25 milliliters at 15:15. In other words, another 0.25 milliliters of morphine was administered 15 minutes later.
Correct.
And this was at 3:15 in the afternoon on June 24th, 2017.
Okay. Yes.
And that was again by either you or Renee Bonner.
Yes.
And the patient, Shirley Couch, was resting comfortably by 15:30 or 15 minutes later. Patient woke up, increased mucus, scared, held her hand, asking for coffee, but strangles easily. Do you see that?
Correct.
And strangles easily is also a potential sign or symptom of a drug overdose.
Objection calls for medical and pharmaceutical.
You may answer.
No.
All right. And cite for me, if you will, any text, treatise, article, peer-reviewed articles, non-peer-reviewed articles, grand rounds.
Okay. Well, I was just strangling.
Anything?
I was just strangling, and I'm not under any drug use of any drugs or overdose. So no, I don't agree with that. I don't have anything to cite it.
Okay. Goes on to read back on page 1 of 2, again, for your skilled nursing visit note dated June 24, 2017 at 1300 EDT. Interventions assess pain level and discomfort with use of flax scale.
Yes,
You completed that.
yes,
Assess pain severity, frequency, location, quality, precipitating factor, side effects. You also completed that.
yes,
And all these that read completed, your conclusions are in your narrative notes that you just read, right?
correct.
On page 2 of 2. Yes?
Yeah. Yes,
Then if you move down the page, here it reads intervention, teach, pain management and comfort measures completed.
yes,
And that's again, that's the proper administration, what, when, how much adverse effects to Renee Bonner. Is that
Yeah.
right?
yes,
And she complied with those, junior knowledge, right?
Calls for speculation.
You may answer.
yeah,
And then the next intervention, teach regarding medications to include dosages, administration, actions, side effects, and possible interactions and signs and symptoms to report to RN. It reads completed, right?
yes,
And by that, you mean you taught Renee Bonner regarding the medications that she and or you were administering to Shirley Couch, including dosages,
correct.
administration.
Yes,
By administration, you mean how much, when, how. Yes.
yes,
The actions of the drugs,
yes,
the side effects of the drugs,
yes,
and the possible interactions of the drugs,
yes,
since she was being given multiple drugs,
yes,
Objection form.
and the signs and symptoms to report to Homestead Hospice.
yes,
That's either one of your nursing colleagues or to Dr. James Michael Shiver.
yes,
If you scroll down here, you see where it reads patient caregiver administers medications appropriately with understanding of side effects and states implications and expected results. And you wrote progress 80%. Is that right?
yes,
And you're referring again to the caregiver as Renee Bonner.
yes,
And this is to administer the drugs that she's administering to Shirley Couch.
yes,
To administer those appropriately and with the understanding of side effects and states implications and expected results.
yes,
And she was able to do that. Renee Bonner was.
yes,
And Renee Bonner did do that.
yes,
Objection calls for speculation.
You may answer.
yes.
And you assessed her progress at 80%.
That's an automatic number that comes up again on this program. It's a care plan.
All
And
right.
you have to have an open care plan to be able to chart. So you can't, it wouldn't be 100% till the end.
So even though you thought it was 100%, the report only shows 80%.
Well, we can only do what we can do. I mean, we teach every time we go in the home. It's, you're constantly teaching, you're constantly reviewing, it goes on all the time.
By constantly reviewing, you mean when you are in the home as a patient advocate, you're constantly reviewing what's being done when you're not there.
Correct.
Objection to the extent it mischaracterizes earlier testimony.
To ascertain, for one, whether the caregiver that you taught is complying with your instructions.
Yes.
And you did that here.
Yes.
And Renee Bonner was complying with your instructions.
Objection calls for speculation.
Yes.
Now, immediately beneath that, patient caregiver will verbalize understanding of pain management regimen, reach progress 60%. Is that also an automatically generated percentile?
Yes.
That doesn't really have any reflection on how you viewed Renee Bonner caring for Shirley Couch.
No.
And immediately beneath that, again, it's this automatically generated 60%. Again,
Correct.
now what time is it? It's 11:50. Miss Allen, how much longer we can, I mean, I've got some more ground to cover here. I don't know whether you want to take a break now and have lunch and come back. Do you want to work another 30 minutes? What are your thoughts? Or do you want to speak to your lawyer about that?
Yeah, I guess I need to speak to my lawyer.
Because we're about to go through another note. So now would be. a good-
Okay, James, let's do a 30-minute lunch break so that this way, the witness has a chance to refresh herself, get something to eat, and then we can come back and then you can.
Let's say why don't we go ahead and make it 40? Let's say 12:30. Is that all right?
Okay, yeah, that's fine. 12:30.
See you at 12:30.
Thank you.
Going off the record at 11:51 a.m. All right, we're back on the record at 12:41 p.m.
Miss Allen, we've covered your June 23rd and 24th skilled nursing visit notes for Shirley Couch.
Okay.
And now I'd like to cover the last two notes that I have, which are both on the 25th. All right.
Okay.
It looks like the first one is on June 25th, 2017 at 11 EDT. I assume that's 11 in the morning. Is that right? If you know.
We don't see your note. I don't know if you're trying to
All
screen
right,
share.
let me pull that up. You see that all right?
Uh-huh. Yes.
Yes, ma'am. See where it reads skilled nursing visit note
Yes.
or patient name Shirley Couch?
Yes.
The date of visit 6/25/2017, 11 EDT.
Yes.
Timeout 13:30 EDT.
Yes.
And if you scroll down here to the bottom, that's your name, Mary Allen, RN at the bottom.
Yes.
This is your note.
Yes.
And so you were with Shirley Couch on the 25th from 11 that morning until 1:30 that afternoon.
Yes.
Where these notes read time in and time out, that's how long you were with the patient that day.
Correct.
And at 11:15 EDT, you took Shirley Couch's vital signs,
Yes.
and she had a slightly elevated temperature, 100.4.
Yes.
Her pulse was 64 beats per minute.
Yes.
It was again irregular.
Yes.
which is a potential sign or symptom of a drug overdose.
Objection calls for a medical opinion, pharmacological opinion.
You may answer.
I don't know.
All right. And her respirations were 16 breaths per minute.
Yes.
They appeared to be regular and easy. Is that what you wrote here?
Yes.
Her blood pressure was 110/64.
Yes.
And what is a blood pressure of 110/64?
It's slightly low.
All right.
I mean, normal is 120/80.
Yes, ma'am. And what's the difference? I think that top number is systolic and the bottom
Correct.
number is asystolic or diastolic. What's the
Diastolic.
difference? I'm sorry?
Diastolic.
Yes, ma'am. And what's the difference in those two numbers? What's the 110 and what's the 64?
110 is the systolic. The top number is the systolic. The 64 is the diastolic.
And systolic, what does that mean? That top number? The 110 is a measure of what? Yes, ma'am.
The pressure in the heart, pumping blood in and then out when it's resting and not resting.
All right. The systolic is with a contraction of the heart.
I believe so, yes.
And the asystole or diastolic is the between the contractions or at rest. Is that right?
Correct.
And then the oxygen saturation is at 92%. That's with supplemental oxygen.
Correct.
I think her supplemental oxygen rate was 2 liters. Is that right?
I don't recall.
Okay. And what is a range of oxygen supplementation that you've seen while working at Homestead Hospice?
Objection only to the extent that it calls for the disclosure of PHI of other patients, but subject to that, you can testify generally about your nursing experience.
All the way down to 0.
Yes, ma'am. 0 up to what?
100.
You can administer 100 liters of oxygen?
I didn't realize that was, what was the question again?
Yes, ma'am. Here, let me take. When you administered, I think we're just getting the top of your face. I mean, I think from your, that's better.
I was listening. I was trying to read. Sorry.
Well, I understand. Well, you can move it. That's probably more flattering, but however you want to do that is up to you. But I was just letting you know that it was cutting your face in half.
Okay.
Okay. So, and my question was, Madam Court Reporter. Oh, the oxygen supplementation. And Shirley Couch, I believe she was at 2 liters. You said anything down to 0. So some patients you don't administer any supplemental oxygen, and some you administer supplemental oxygen up to what in your recollection?
Well,
And
I've
so
had
objection only to the extent you can provide general information, but please don't breach any state or federal privacy laws regarding any specific patient, okay?
Okay. If I understand correctly, you're asking me how
Okay.
much oxygen do I apply to patients?
Well, I'm asking for a range of oxygen supplementation. Yes, ma'am. In your
Anywhere
experience
from
at Homestead.
anywhere from no oxygen
Yes, ma'am.
at all to, I mean, I've had patients on a ventilator. So that I don't know how to answer that question.
Well, ventilator is a little different from supplemental oxygen, right?
Well, it's supplemental oxygen.
Yes, ma'am, but it's patients also being ventilated.
Mm-hmm.
That's not what's going on with Shirley Couch, is it?
Well, you asked about all my patients.
Yes, ma'am, but I'm talking about Shirley Couch received supplemental oxygen. She was not on a ventilator, to my understanding, right?
No, sir.
But what's the difference in a ventilator and supplemental oxygen?
The amount of oxygen that you need.
Well, a ventilator also does the mechanical work for the patient, which supplemental oxygen does not, right?
Correct?
Objection only to the extent that you're calling for medical opinions or opinions from of a respiratory therapist from the nurse, but subject to that, you can answer.
So for supplemental oxygen, where you merely supplement the patient's oxygen with more oxygen, the range of oxygen supplementation that you've administered while employed at Homestead Hospice was from what to what? I think you said from 0 on the bottom end, and you were talking about a ventilator, excluding a ventilator, just supplemental oxygen.
All right, 10 liters.
All right. 10, you said?
Yes.
10. Now, your note, and at, I believe, Shirley Couch was on 2 liters. Oxygen saturation was at 90 or 92% with supplemental oxygen. Is that right?
Correct.
Your narrative notes here, daily visit made to check on patient upon arrival, patient moaning. You agree that a patient moaning is a potential sign or symptom of a drug overdose?
Objection calls for medical pharmacological opinion.
You may answer.
Could be that or discomfort.
Yes, ma'am. Laying in bed with no covers on. That's what you wrote.
Correct.
Family reports that patient has been awake most of the night. When they changed her brief this morning, it was very dark. Patient screamed during personal care and was unable to get another diaper on. Declined Foley placement. Talking about a catheter there. Is that right?
Correct.
Daughter Renee medicated with 1 milliliter of morphine. That's what you wrote?
I don't see it in front of me. I need the note.
Oh, thank you. You see that?
Yes.
All right, we're still on skilled nursing visit note for Shirley Couch. Your note on for the data visit 6/25/2017. Your time in was 11 EDT and your time out was 13:30 EDT. This is your narrative note. I'm going to move that to the top of the screen so that you
Okay.
can see that better. Is that better?
Yes.
All right.
All right. I see that.
You see there where it says daughter Renee medicated with 1 milliliter of morphine per order.
Yes.
And what we saw in the previous note, it didn't read daughter Renee medicated. It said gave, right?
Correct.
So that's why it indicated to you that could have been either you or Renee. Is that right?
Correct.
Daughter Renee medicated with 1 milliliter morphine per order, can have Q2 hours, but has been sporadically giving 0.3 milliliters with no relief. Do you see that?
Yes.
So Renee was medicating with 1 milliliter of morphine per Dr. Shiver's order,
Objection calls for speculation.
right?
Yes.
According to your note.
Yes.
And it goes on to read, per the order, can have Q2 hours. In other words, that's what, 1 milliliter of morphine per
That was-
hour or 2 hours?
Yes. 1 milliliter. At that point, it was 1 milliliter every 2 hours. It's a
Yes, ma'am.
standard order that we have.
Right. And but did that order increase or decrease after that?
It increased
It increased to what?
every 1 hour.
Yes, ma'am. Half a milliliter of morphine every hour. Right.
1 milliliter every hour.
Thank you. Got it. In other words, it went from 0.5 to 1 milliliter per hour. Is that
No,
right?
the original,
Objection to the extent that the testimony is being mischaracterized and is not what she read off the exhibit that you showed her earlier with regard to the doctor's order dated June 24th.
Yeah, we'll get to the drugs in a minute. If you could tell me what the change was though, from what to what that you're
The
referring
order
to?
was for 0.25 to 1 ml every 2 hours
Yes,
as
ma'am.
needed. Then it changed to 0.25 to 1 ml every hour as needed.
All right. So it went from the same dose of the drug morphine went from every 2 hours to every hour.
Correct.
And when was that change?
I don't recall.
All right. That's in the medical record though, right?
Correct.
And that's right, where each per order can have Q2 hours, but has been sporadically giving 0.3 milliliters with no relief. When you wrote sporadically giving 0.3 milliliters with no relief, tell me what you mean there.
She wasn't given enough. She was only given 0.3, and the patient was not remaining comfortable. She had continued agitation. She had had a bad night. She was saying it hurts.
Yes,
So
ma'am.
she was not given enough medication to keep her comfortable.
And you were able to tell that she'd only been given 0.3 milliliters sporadically based on
What she told me.
what Renee Bonner told you,
Correct.
and also Renee Bonner's documentation.
No, what Renee told
Calls
me.
for speculation.
Okay, well, did you expect Renee Bonner to remember the amount and time for every dose that she gave her when she was doing it sometimes multiple times an hour?
Objection calls for speculation.
You may answer.
Yeah, that's, I mean, however she remembers.
And the reason nurses are required to make notes is because your memory can be faulty, right?
Objection calls for legal conclusion. You can answer.
We make notes just to keep up with what we're doing.
Right, because nurses, like the rest of us, are human, right?
Correct.
And we all make mistakes, right?
Correct.
So when we record or reduce to writing patient information, that can eliminate some potential memory lapses or memory issues. True?
It could.
Encouraged to give morphine, Xanax, and Valium. That's what you told Renee Bonner?
Correct.
To give morphine, Xanax, and Valium per
Correct.
doctor's order?
Correct.
And that's what Dr. James Michael Shaver ordered for morphine, Xanax, and Valium to be given at the same time.
Correct.
Objection to the characterization of prior testimony.
May I answer?
Correct.
And you encouraged Renee Bonner to do exactly that, to, per Dr. Shiver's order, give morphine, Xanax, and Valium to Shirley Couch.
Yes, to help keep her comfortable.
All right. And that goes on to read for patient comfort, right?
Yes.
Yes, ma'am. Patient has fever 100.4, cool cough to forehead applied. Patient refusing to drink or eat. You see that?
Correct.
Refusing to drink or eat is also a potential sign or symptom of drug overdose. True?
Objection calls for medical and pharmacological opinion.
You may answer if you know.
I don't know.
Continued education with family about S/S. That means signs and symptoms
Correct.
of patient transitioning.
Correct.
Will fall with any questions or concerns.
Yes.
That concludes your June 25th, 2017 note when you were with the patient from 11 that morning until 1:30 that afternoon.
Correct.
Now, you didn't examine Shirley Couch's pupils. Is that right?
Well, No.
Okay. And you agree that constricted pupils are a potential sign or symptom of a drug overdose?
Objection, calls for speculation, calls for medical pharmacological opinion.
You may answer.
Yes.
You agree that not documented means not done?
Correct.
And you agree that a change in skin color or condition can also be a potential sign or symptom of a drug overdose?
Objection, calls for medical and pharmacological opinion.
I would say no.
Okay. Any sites for that?
No.
I'd like to move on to the last note in your records, which is your skilled nursing visit note for Shirley Couch, again dated June 25th, 2017. Time in 21:30, time out 23:55. Is that right?
Yes, it is.
So again, according to this note, you were with Shirley Couch from 9:30 in the evening until nearly midnight, 11:55 that night. Is that right?
Correct.
Again, you took vital signs, right?
Correct.
And again, Shirley Couch's pulse was irregular,
Yes.
which is also a potential sign or symptom of a drug overdose.
Objection, calls for medical pharmacological opinion.
You may answer.
No.
Okay. No sites for that.
No.
Respirations, 13 breaths a minute. These are irregular now.
Correct. Mm-hmm.
You agree that irregular respirations can also be a sign or symptom of a drug overdose?
Same objection.
Ma'am,
Can be, but also in transitioning.
by transitioning, you mean dying.
Yes.
You agree that patients can die of a drug overdose too?
Objection, calls for medical opinion.
Well, I'm sure they can.
Yes, ma'am. So a patient can be transitioning as a result of a drug overdose. True?
Objection, calls for medical opinion.
You may answer.
It could happen.
Yes, ma'am. Now, and again, you've got a narrative note here.
Yes.
You were with the patient. If you look up here in the upper right, the time, you've got billable and then the time. So you were with the patient 145 minutes. Is that right?
Yes.
And on the earlier that day, you were with the patient 150 minutes.
Yes.
So 150
Well-
minutes. I'm sorry, go ahead.
Well, 11 to 1:30. 11, yeah, 150 minutes. Yes.
Yeah. And then at 150 minutes is 2.5 hours. Is that right?
Yes.
And
Yeah.
145 minutes is, let's see, what is that? 2 hours, 25 minutes.
Yes.
And your narrative note here reads, patient breathing shallow. Do you see that?
Yes.
And shallow breathing is also a potential sign or symptom of a drug overdose. True?
Yes.
Goes
Objection,
on,
for medical pharmacological opinion.
it goes on to read, upon arrival, multiple family members present, patient moaning. Do you see that?
Yes.
It's also part of your note.
Yes.
That's also a potential sign or symptom of a drug overdose.
Same objection.
You may
I don't
answer.
agree. I don't agree.
Any cite for that?
No.
All right. Patient given morphine by POA ×1. Do you see that?
Yes.
POA, you mean power of attorney?
Yes.
That's Renee Bonner.
Yes.
And that's, of course, different from just gave the drug, as in your earlier notes from the 23rd and 24th. True?
True.
For moaning and facial grimacing with good results.
Yes.
It reads Italy's as charted.
It's vital signs.
Yes, ma'am.
It was the text to time.
I'm sorry.
It was a mistype or
Yeah, I got you.
autocorrect.
Able to obtain pulse, let's see, able to obtain pulse ox. You see where it says 10 to 15 seconds of apnea noted?
Yes.
What is 10 to 15 seconds of apnea?
When a patient is transitioning, they will start having different kind of respirations where they will hold their breath for 10 to 15 seconds, and then they'll take a breath, and then they'll catch up. She
Yes,
was
ma'am.
having 10 to 15 seconds of apnea, which is
But-
concurrent with a patient transitioning, which is what patients in hospice do.
Right? That for 10 to 15 seconds, the patient was not breathing. True?
Correct.
That's what apnea means, right?
Correct. Yes.
And by transitioning, you again mean dying. Is that right?
Yes.
So that was a sign that Shirley Couch to you was dying.
As a hospice patient, she was appearing to transition with all the signs and symptoms that I was seeing, the confusion, the increased pain, the apnea, the decreased vital signs, the decreased urine output, the not eating, the agitation. All of those are signs and symptoms that we look for in a patient that is transitioning, and then educated the family as such.
Well, you agree that confusion is also a potential sign or symptom of a drug overdose. True?
Objection
I don't
calls for
know.
a medical and pharmacological opinion.
You may answer.
I don't know.
You also agree that shallow breathing is also a potential sign or symptom of a drug overdose.
Same objection.
You may answer.
It can be.
You agree that an irregular pulse is also a potential sign or symptom of a drug overdose.
I don't
Same
know.
objection.
You agree that irregular respirations are also a potential sign or symptom of a drug overdose.
I
Same
don't know.
objection.
Did you answer?
I don't know.
Okay. You agree that apnea or cessation of breathing for 10 to 15 seconds at a time is also a potential sign or symptom of a drug overdose.
I don't
Same
know.
objection.
What?
I don't know.
All right. You agree that agitation is also a potential sign or symptom of a drug overdose.
No,
Same-
I don't.
Okay, any cite for that?
No.
All right. It goes on to read multiple family members educated on signs, symptoms of death, dying. Do you see that?
Yes.
Based on what you observed, Shirley Couch was dying, right?
If things continued to the way they were going, I felt like she was going to transition and pass, which is why I had the family notified and have been brought to the bedside.
Yes, ma'am. And by transition or die, you expected her to die within hours or days, not weeks or
No.
months. True?
Objection calls for speculation.
You
I
may
did not-
answer.
I did not give a time. It could be days to a week.
Okay. So she had up to a week to live based on your observations at the time.
Objection calls for speculation.
No, I don't give times. It could be anywhere, but she was, if she continued with this, portraying these symptoms, she would continue until she passes.
Right. You're aware that she's still alive.
Yes, I am.
All right. And you're aware that on the 26th, she was transferred to Athens Regional Medical Center.
Yes, I'm aware.
You're aware that they stopped the drugs and her signs and symptoms of dying stopped.
I'm not aware. of
Objection
what-
calls for speculation.
You may answer.
I don't know what they did.
Okay. You know a Dr. Gina Singh?
No, I do not.
You're not able to make medical diagnoses, right?
No,
But you're not a physician, right?
correct.
And you would defer to a physician, particularly a board certified physician in internal medicine, with decades of experience to make a proper medical diagnosis.
Objection calls for speculation.
You may answer.
I mean, any doctor could.
Yes, ma'am. And you cannot.
I
Right.
cannot, yes.
Goes on to read comfort measures and care of terminal patient, and you considered Shirley Couch to be a terminal patient.
If you're a hospice patient, you're a terminal patient.
Yes, ma'am. By definition.
Yes,
All siblings at bedside encouraged to speak to patient, let her know that they were all there and would take care of each other. That's what you told the family members to do?
yes, because there was disgruntled family members. There was probably issues with the families, and I felt like that was part of her agitation because she knew that her family was fighting amongst themselves. So I'd encourage them to come together as a family so that this time would be peaceful and comforting, and she would be able to pass easily and comfortably and with dignity.
Yes, ma'am. It goes on to read patient, minimally responsive.
Yes,
That's what you wrote?
yes,
And Shirley Couch was minimally responsive.
yes,
You also agree that minimally responsive is also a potential sign or symptom of a drug overdose.
Objection mischaracterizes any form or testimony, also calls for speculation, calls for medical opinion and pharmacological opinion.
You may answer.
it can be.
Yes, ma'am. Goes on to read, does not open eyes. Do you see that?
Yes,
You agree, not opening eyes, particularly when you're communicating verbally with a patient, is also a potential sign or symptom of a drug overdose.
Same objections.
You may answer.
same answer. It can be.
Yes, ma'am. Goes on to read, verbally responds with soft voice.
Yes,
Also a potential sign or symptom of a drug overdose.
Same objection.
You may answer.
could be.
Goes on to read, and one word answers at times, also a sign or symptom of a drug overdose,
Same
potentially.
objection.
I don't know that one.
All right. Family tearful, emotional support offered to all siblings and multiple family members. Observed no change in patient for 2 hours. Is that what you wrote?
Yes,
And you also observed the care that was administered over those 2 hours and 15 minutes,
yes,
which was also appropriate based on your instructions.
yes,
Patient comfortable upon exit. You're talking about your exit, right? When you left.
correct, correct.
Instructed to give comfort meds per doctor's order. The comfort meds, you mean the morphine, the Valium, Ativan,
Correct.
hydrocodone, Norco.
I don't recall those.
All right, we'll go through the medications, the drugs that she was administered next. Call 24/7 with any questions or concern. Upon accident, all siblings verbalize gratefulness and hug nurse goodbye. Remember that?
Yes, I do.
All right. I'd like to show you what's been marked as number 7, Madam Court Reporter.
7, correct.
Thank you. Marked as exhibit number 7 to your deposition. You see that all right?
Yes.
This is your interview with the Georgia Bureau of Investigation
Okay.
on July 6, 2017. Do you recall that?
Yes.
And have you seen this document before today?
No.
Let me send that over to you so that you can look at that. All right, I just sent that to your lawyer. You mind sending that on to her?
As soon as I
Please.
get it in my inbox, sure.
Well, how do
And,
I look at it and be on this thing? I don't,
You want to go off the record for a minute? I'm gonna have to send it to you.
I'm happy for you to review that, and then you let me know when you're ready to, and we'll pull it up and we can talk about it then. Is that all right? Is that better?
Yeah, that sounds good.
Okay. Did you get it?
Going off the record at 1:14 PM.
Okay.
We're back on the record at 1:20 PM.
Right, did you have an opportunity to review the investigative summary of your conversation with GBI Special Agent Katie Hartzog on July 6, 2017?
I did.
That's been marked as exhibit. Is that 7, Madam Court Reporter? 7, yes. And does that accurately reflect your conversation with Agent Hartzog?
From what I recall, it does.
Yes, ma'am. And if you look on page 2 of 4, that second paragraph, do you see that? Here, I'll pull it up.
Okay.
Hold on one side. See here, page 2 of 4. Do you see that second full paragraph?
Alan stated at the beginning of the weekend?
Yes, ma'am.
Yes.
You see where it reads, Allen thought Couch was not medicated enough?
Correct.
And that was your belief then?
Yes.
Still your belief now?
Yes.
And that was based on your observations that she was still in pain, notwithstanding the medications or drugs she was being administered?
Correct.
All right. All right. I'm going to show you what's been marked as Exhibit 8 to your deposition.
Okay.
You ever seen this document before?
No. I mean, yes, I have in court.
Okay. You mean, by in court, you mean at the criminal trial for Renee Bonner?
Correct.
Yes, ma'am. And you remember testifying about this document then?
Well, I remember testifying. I don't know. I mean, I saw this in court.
Yes, ma'am. And you testified about this document in court?
If they asked me questions about it, I did.
Yes, ma'am. You don't remember any of those questions or answers, though?
Oh, I do not recall.
You were under oath then, so to the extent that that transcript provides answers, you agree that your answers in that trial were truthful?
Absolutely.
Yes, ma'am. And do you recognize his handwriting?
No, I don't.
All right. If you look at page, this is the first page of Exhibit 8 to your deposition. These appear to be handwritten notes.
Yes.
And to the left, they've got dates, looks like 6/22 and 6/23.
I do see the dates. Yes.
And in the right-hand column are times.
Yes.
And between the dates and the times are drugs. Is that right?
Well, that's what's written.
Yes, ma'am. The first drug written in the first line on this document is 622 morphine. Morphine appears to be misspelled, right?
Correct.
And it goes on to read 10 p.m.,
Yes.
right? So to the extent that morphine was administered on June 22nd at 10 p.m., how can you tell from this note how much was administered?
Objection, foundation calls for speculation.
You may
Well,
answer.
I don't know that anything was administered. It's just written here. I don't know what that means.
Yes, ma'am. That's not my question, though. Would you read back my question, please, Madam Court Reporter?
Question: to the extent that morphine was administered on June 22nd at 10 p.m., how can you tell from this note how much was administered?
Same objection.
And same answer. I can't tell that anything was administered.
Well, and if you assume that morphine was administered on June 22nd at 10 p.m., there's no way based on this note to know how much was administered.
Objection, foundation calls for speculation.
You may answer.
I don't know what this means. I don't know that anything was given. I don't know how much was given. I don't know what was given or if anything was given. This is a piece of paper with writing on it that I know nothing about.
Well, it's a piece of paper with writing on it that you were questioned about in the criminal prosecution of Renee Bonner, wherein she was convicted of attempted murder and elder abuse. True?
Objection calls for legal conclusions.
You may answer.
Apparently, yes.
Yes, and it's got the same investigation number that's on your investigative summary when you were questioned by GBI Special Agent Katie Hartzog 11-0148-25-17.
Okay.
Yes? Is that a yes?
I don't have the other number in front of me, but
Let me pull that up for you. This is back to Exhibit 7. You see that?
okay, the 110148. Okay.
-25-17.
Okay.
And that's the same number.
That's
It's on
right there.
Exhibit 8, is it not?
So yes, this was in court, which I said was. That's where I saw it.
Yes, ma'am. And the first line, you agree that there's no amount of any drug administered on that line, right?
Objection, foundation calls for speculation.
You may answer.
I don't see anything written on the line about any amounts of any and what this is saying.
Yes, ma'am. And as a nurse, if you administer a drug, you would record the drug.
Objection calls for a legal conclusion.
You may answer.
Yes.
You would record the amount of the drug administered.
Objection calls for a legal conclusion.
Yes, I would.
You would record the date the drug was administered.
Same objection.
Yes.
You would record the time the drug was administered.
Yes.
Same objection.
And you would record any observations that you felt like were necessary to be recorded.
Same
i.e.
objection and
adverse effects as a result of the drug.
Yes.
Same objection to the extent that, and also objecting to the extent that you're asking a question that requires a standard of care that's different from a home hospice to a nursing, a hospital setting.
You may answer.
Yes.
Anything else that ought to be recorded by a registered nurse when she's administering drugs to her patient?
Same objection.
No.
Now, if you look on the next line, you see 6/23, which in date format is June 23rd. Yes.
Yes,
And you read to the right, it reads 6 o'clock. Is that right?
that's what that says.
And this reads hydrocodone, which appears to be hydrocodone misspelled.
It says Hackedone, yes.
And there's, again, no amount of hydrocodone administered.
Not written there.
Yes, ma'am. The line beneath that, 0.25 morphine at 7:30. Do you see that?
I do.
Another 0.25 morphine at 7:45. Do you see that?
That's what's written.
Yes, ma'am. Another 0.25 morphine at 8:33. See that?
That is written, yes.
And then you see 2 diazepam at 8:45.
That is what's written, correct?
And I don't, diazepam, is there another name for diazepam?
Valium,
Yes, ma'am. And what is Valium?
Objection to the extent it calls for a pharmacological opinion.
anti-anxiety med.
All right. It's not an opioid, right?
Same
No,
objection.
I mean, if you know.
no,
And if you scrolling down the same exhibit, see where it reads 6/23 with the numeral 5 circled, diazepam, 2 tablets. You
yes,
see that?
yes,
And diazepam, again, that's Valium. Is that right?
yes,
Beneath that, June 24th at 6 o'clock, morphine 0.5,
yes,
9:30 morphine 0.5.
Objection, foundation speculation.
that's what's
What the
written, yes.
document reads, right?
I'm reading it, yes.
11:02, more diazepam, 1 tablet.
Same objection.
That is what's written,
3 o'clock, morphine 0.5. Is that right?
Same
Yes.
objection.
that is what's written,
And then continuing 3:30 or half an hour later, according to these notes, another 0.25 of morphine.
Objection to the extent this whole line of inquiry implies that she saw or witnessed or gave any of these medications. Foundation calls for speculation.
yeah, I don't know that this is in continuation of those other meds. And I don't know that those meds were given. I just know that's what's written on this piece of paper.
Ms. LeRae, if you make another speaking objection, I'm going to file a motion. All right? I'm going to ask the court reporter to read back this question, and I'd like an answer from the witness. If you have an objection, make it and state the legal basis of the objection.
And that's what I've been
Madam
doing.
Court Reporter, would you read back the question,
I'll
please?
continue to
ma'am?
do that, James. I'll continue to do my job.
Madam Court Reporter, would you read back my question?
Question, and then continuing through 30 or half an hour later, according to these notes, another 0.25 of morphine.
Objection, foundation calls for speculation.
You may answer.
That is what's written, but I don't know
Yes,
that
ma'am.
that is not in continuation of that other piece of paper. It's a totally different piece of paper.
Immediately beneath that is 5:30, and it's written Ativan and 0.5 morphine. Do you see that?
Same objection.
I see it.
Yes, ma'am. Is the amount of Ativan that was given written here?
Same
No.
objection.
You may answer.
There's no amount written and there's no, it not necessarily given, but there's nothing written there about how much Ativan.
Well, when you have a patient, you write down drugs with a date and a time just to write them down? To
Not
confuse
always.
listen, to confuse another nurse or another healthcare provider or doctor? Is that your practice?
Objection, argumentative.
You may answer.
What was the question?
Would you read it back, please, Madam Court Reporter?
Question, well, when you have a patient, do you write down drugs with a date and time just to write them down to confuse? Answer, not always. Question, listen, to confuse another nurse or another healthcare provider or doctor. Is that your practice?
The same objection.
You may answer.
I don't understand the question you're asking. I mean, I'm getting very confused.
Would you read it back, please, Madam Court Reporter?
Can you ask the question a different way that I can understand it?
No, ma'am. I'm going to have the court reporter read it back. If you
Okay.
can't answer it, you tell me you can't answer it, and we'll move on from there.
Okay, read it again.
Question, well, when you have a patient, do you write down drugs with a date and a time just to write them down to confuse? Answer, not always. Question, listen, to confuse another nurse or another healthcare provider or doctor. Is that your practice?
Same
No.
objection.
No, I don't write things down to
Right.
confuse people.
Yes, ma'am. Do you instruct the Renee Bonner to do that?
No,
All right. Did you instruct anyone else regarding Shirley Couch to do that?
no,
Would you expect Shirley Couch's family members to make up numbers?
Objection calls for speculation.
Don't interrupt me again. To make up numbers and write down dates and times and drugs?
Objection calls for speculation.
You may answer.
Well, having met these people and dealt with these people, yes, I would expect them to make things up.
Okay. So you expect that Renee Bonner made up the dates and times and amounts of drugs that she administered?
No. not-
Objection, speculation.
What's that? Your
No,
answer?
no,
Well, you've already testified that Renee Bonner was the only person administering drugs per your instructions.
Objection mischaracterizes earlier testimony.
You may answer.
my answer stands. No, Renee did not make anything up.
That was not my
And
question.
I don't know who wrote these. I don't know who wrote these.
Do you read back my question, please, Madam Court Reporter?
Question, okay, so you expect that Renee Bonner made up the dates and times and amounts of drugs that she administered?
Absolutely not.
All right. And Renee Bonner was the only person that administered drugs to Shirley Couch other than yourself.
Objection calls for speculation, mischaracterizes earlier testimony.
I don't know who administered meds when I'm not there.
Tell me who you know of that administered drugs other than Renee Bonner.
I don't know what went on when I was not there. I don't know.
That's not, would you read back my question, please, Madam Court Reporter?
Question, tell me who you know of that administered drugs other than Renee Bonner.
Objection asked and answered.
You may answer.
I have no idea who all gave her medication when I was not there.
The only person you instructed on how to administer the drugs to Shirley Couch was Renee Bonner.
Objection
Paula,
characterizes earlier testimony.
and Paula over the phone.
Paula Stuchel?
Absolutely. Every time we were there, we talked to her on the phone.
Did you ever meet Paula Stuchel in person?
Once she got there on Sunday,
Sunday. What day was Sunday?
Whatever that last day out when the whole family member, all the family members were there.
Anytime before that date?
No, I had not met her, just talked to her on the phone.
All right. Back to Exhibit 8. You see where it reads 5:30 Ativan?
Yes,
There's no amount of Ativan listed.
correct.
It goes on to read 0.5 morphine.
Objection, foundation, speculative.
You may answer.
That's what it reads.
Goes on to read 7:30. 7:30 is 2 hours after 5:30.
Yes,
Diazepam, well, again, no amount given.
Same objection.
You may answer.
that is what's written.
It also reads at 7:30, 0.5 morphine.
That's what's written.
Same objection.
9:30 reads 2 hours later, Ativan. Do you see that?
Same
Mhm.
objection.
Yes,
There's also no amount written for Ativan.
correct.
Also reads 0.5 morphine.
Same
Correct.
objection.
See where there's a star and it says any pain at all, give 0.25 morphine. Is that right?
Yes,
Is that what you told Renee Bonner?
yes,
All right. Goes on to read 625 on the left. You see that?
yes,
625 in date format stands for June 25th, does it not?
yes,
It reads 3 a.m. morphine 0.25. Do you see that?
yes,
Objection, foundation, speculation.
Diazepam 1 tablet. Do you see that?
yes,
3:45. That's 45 minutes later, according to this note. Morphine 0.5. Is that right?
Same objection.
that's what is written.
At 4:30, another 0.25. You see that?
Same
I-
objection.
I see 0.25 written.
And then at 8:48 a.m., another 0.5 morphine. Do you see that?
Same objection.
I see 0.5 written.
And then at 8:57, you should see that one tab, diazepam.
Same objection.
I see that's written.
And then at 8:59 or 2 minutes later, you see where it reads morphine 0.25.
Same objection.
See where that's, I see 0.25 is written.
And then 9:39.5. You see that?
Same
I see
objection.
0.5 written.
10:03, another 0.25.
Same objection.
Again, 0.25 written.
10:30, another 0.25. You see
Same
that?
objection.
I see that written.
Then do you see on the next page at the top, it reads Mrs. Couch. You see that?
I do.
You recall any other patients named Couch?
No,
It reads 11:30. There are 3 columns, morphine, Ativan, and Valium. Do you see that across the top?
I do.
And do you see to the left of morphine 1 ml,
I do.
which stands for 1 milliliter?
Yes,
You see at 11:30, 1 milliliter morphine, a box is checked.
Objection, foundation, cause for speculation.
Let me answer.
yes,
Then at the same time at 11:30, Ativan was also administered according to this note.
Same objection.
I don't know that it was administered, but this is checked on here.
According to the note, it was.
I don't know what the note means.
Or they just made it up.
Argument, objection, argumentative.
You may answer.
I don't know.
All right. And then again, for the Ativan, there's no amount. Right?
Objection, cause for speculation.
I don't see anything written.
And then at 1:30, now Ativan, what is Ativan? Is that an opioid?
No,
And cause
Is it
for
a benzo-
pharmacological opinion.
Is it a benzodiazepine?
yeah,
Same
All right. And then at 1:30, 2 hours later, the 1 milliliter morphine box is checked again. Do you see that?
I do.
And at 1:30, the Valium box is checked.
Same objection.
You may answer.
Yes, I see it checked.
No amount given again.
Same
for the
objection.
Valium. And then you see at 3:30, the 1 milliliter morphine box is again checked.
Same objection.
I see it checked.
You see at 3:30, the Ativan box is again checked.
Same objection.
I see it checked.
Again, no amount for the Ativan.
Foundation, speculation, objection.
You see that?
I see it. I said yes.
And then you see at 3:40 where it reads 1 milliliter. You see
Same
that?
objection.
I see
Under
where
the-
someone wrote in 340 and 1 ml and a check.
Right. It's under the morphine column again. Is that right?
I see where it is written 340, 1 ml and a check.
Under the morphine column.
It looks like, yes.
And at 4:30, well, actually at 3:49, there's another 1 milliliter under the morphine column.
Objection. Foundation calls for speculation.
It's what is written.
Yes, ma'am. Then at 5:30, well, actually at 5:15, there's a check mark under Ativan again. You see that?
I do.
And then at 5:30, there are 1 milliliters under the morphine column. Is that right?
Same objection.
It's hard to read, but it looks like it's 1 ml or 1 ml is written.
It's written 2 times, right?
Objection.
I see it
Speculation.
under 630. It's written 2 times. I don't know.
Okay.
It's very hard to read.
Oh, that's fine. There, between 5:30 and 6:30 under the morphine column, there are a total of 3 ml. So it could be 1 at 5:30 and 2 at 6:30, or 2 at 5:30 and 1
Yeah.
at 6:30.
The way
Yeah.
it's,
Objection calls for speculation.
I just see a bunch of scribbling.
Okay. And then you see under the Ativan column, there's 5:15 with a check mark about it.
Yes.
And also under the Ativan column, there are 2 more 1 mLs with 605 underneath it.
Same objection.
I see it.
Then to the right, there's another 718 with an ml next to it. It stands for milliliter, right?
Same objection.
It's under the volume column, but yeah.
And then at 737, an ADV, do you see that?
I do.
And then at 7:30, there's another 1 milliliter check mark under the morphine column,
Same objection.
I see it.
and another check mark under the Ativan column.
Same objection.
I see it.
And at 9:30, under the morphine column, another 1 milliliter check mark,
I see it.
Same objection.
right? And then you see a blank page, which appears to be the back of that page. Yep. You see that?
I do.
And based on this exhibit that was admitted at the criminal trial, I want you to assume that the medications listed there and the amounts that you can discern on the dates and times that we reviewed were given. In your view, that amount of Ativan, morphine, and Valium was, quote, Allen thought Couch was not medicated enough. Would you agree with that statement?
Objection to form compound.
You may answer.
You asked if I agree that all these medications were given?
No, ma'am. You want me to
Okay.
have the court reporter read it back again?
Yes.
Would you read it back, please, Madam Court Reporter?
Question, and based on this exhibit that was admitted at the criminal trial, I want you to assume that the medications listed here and the amounts that you can discern on the dates and times that we reviewed were given. In your view, that amount of Ativan, morphine, and Valium was, quote, Allen thought Couch was not medicated enough. Would you agree with that statement?
Okay. The first part of the question was,
Same objection. Excuse me, the same objection, objecting to form, also objecting to the extent it calls for a medical pharmacological opinion.
You may answer.
The first part of the question, you said, do I agree that this was given? This amount of medication was given? No, I do not
No,
agree.
ma'am, that's not my question.
Okay, then re-ask the question a different way.
It's going to be my job at trial to prove these facts, all right?
Mhm.
Based on the document that we just reviewed, that you were also questioned about at the criminal trial, I want you to assume that those drugs were administered on the dates and times given, and the amounts, where you can tell what amounts were given. And you stand by your comment that you gave to Agent Hartzog, Special Agent Hartzog, that, quote, Allen thought Couch was not medicated enough.
Objection to form, calls for speculation, calls for medical opinion. You can answer.
Again, I feel you're asking me to say, assume, you even said the word assume, that these were the amounts given. I don't know what was given. I was not present.
Yes,
I
ma'am.
can only attest to what was given when I was present.
Right.
So I don't know how else you want me to answer that.
I want you to do, I want you to assume that they were given.
I'm
Just
not
like-
going to assume anything.
Yes, ma'am, you are.
No, I'm not.
Objection, calls for speculation. You can answer the question, but answer it to the best of your ability, Miss Allen. We understand that he's making assumptions based on his question.
Okay, then I don't know.
You don't, you think she was not medicated enough if she was given these meds?
I don't know that she was given these meds.
I'm not asking you whether you knew that she was given these meds. I'm asking you, I'm telling you, for the purposes of this question, you're required to assume that what's in this document was given. Do you understand that part?
No, I don't. I don't know how I can be required to assume this was given if I wasn't there to see it given.
That's not your job. Your job is to answer the question.
I'm going to object. Argumentative. She's answered the question multiple times. Also calls for speculation. Miss Allen, you can answer the question one last time.
I do not know.
You don't know whether that was too much medicine.
Jim, we need to move on from this line of questioning. The witness
She's
has already
gotta-
said,
She's
she's already answered. I've objected. She's already asked and
We'll come
answered that.
back. No, she
She's
hasn't.
She has asked and answered that question multiple times. And if you want, Bonnie can
No,
read
she
back.
hasn't. And she got plenty of coaching from you, which has gotten her in a lot of trouble, and it's about
She's
to
not
get her
gonna-
in more trouble.
No.
Yes, she has.
No, you're making idle
Yeah.
threats now. She doesn't
No,
have
this
to give
is-
you
I
an
don't
answer.
make
that you
threats.
want. That's what you're wanting. You're wanting her to give you the answers that you want instead of her truthful testimony.
No,
Please
no,
stop that. And she's already answered the question multiple
Answer the
times.
question.
You can answer it one last time, Miss
You
Allen. I'm
understand the
sure we
question?
have multiple, the record will show it's been asked multiple times.
The question of, again, repeat the question.
Sure. It's my job at trial to prove the fact. That's not your job. Right? You understand that, right? Miss
Okay.
Allen?
Yes,
All right.
I understand.
Right. So it's not your job to prove what's in Exhibit 8 to your deposition. You understand that? That's my job, right?
Correct.
I can ask you what's called a hypothetical question. And you're required to answer it under oath. And that hypothetical question is this. I want you to assume that what's in Exhibit 8, which is the Georgia Bureau of Investigation's exhibit that was admitted at the criminal trial of Renee Bonner, is accurate. We just went through it. And that the drugs that you can discern from this handwritten document were administered on the dates and times administered. And you still stand by your statement under oath to Agent Hartzog that Allen thought, Allen being you, Couch was not medicated enough. Do you stand by that statement?
There were
Same
di-
objections.
Go ahead.
May I answer?
There were times that she was not medicated enough, correct?
And though she was not medicated enough on the times that you were there on the 23rd, 24th, and 25th.
Correct, because medicine was given.
All right.
I've got to plug in my laptop,
That's fine. You need to take a break?
please.
All right. How long? 5, 10 minutes?
5 minutes.
Yes, ma'am. I'll be back. See you in 5 minutes.
Okay.
All right, we're back on the record at 2:02 PM.
So Ellen, I'll show you what's been marked as Exhibit 9 to your deposition. I believe it's 9. Have you ever seen that document before?
It was in the chart, so yeah.
Yes, ma'am. It's let's see, can you still see that?
Yes.
It reads upper left Homestead Hospice physician's order, Shirley Couch, and on the left the dates are 6/2/17. It looks like all of those.
That was her admission orders.
Yes, ma'am. Is this also referred to as a home care kit?
Yes, it's an emergency kit, e-kit,
E-kit, thank you.
comfort pack.
Comfort pack, okay. So, yeah, I've got here comfort kit. So comfort pack is what
Mhm.
you would call this.
Right.
And this is so on the June 2nd, and her first day under Homestead Hospice care was June 1st. Is that right?
I don't recall.
All right. These are her initial drug orders. Is that right?
This is for the comfort pack orders.
Yes, ma'am. It got acetaminophen,
Correct.
then bisacodil. I can't see that. Is that what that is?
Yes.
The constipation drug.
Correct.
Haloperidol, also referred to as Haldol.
Correct.
That's an antipsychotic medication. Right.
Anti-anxiety.
All right. Then thiamine, is that right? And that's for excessive secretions.
Correct.
Then morphine, 20 milligrams per milliliter.
Correct.
Taken 5 milligrams to 20 milligrams, 0.25 milliliters to 1 milliliter. PO, that's per oral. SL, that's sublingual every 2 hours or as needed for pain.
Correct.
And SOB, that's shortness of breath.
Yes.
And it goes on to read lorazepam, and there's another name for lorazepam.
Ativan.
And that's 0.5 milligram tablets. Take 1 tablet. PO, that's per oral. SL, is that also sublingual?
Yes.
Every 4 hours. PRN, anxiety.
Yes.
And then also promethazine, 25 milligram tablet. Is that right?
Correct.
Hospice covers all medications listed. Why is that written there?
Just letting the pharmacy know that hospice will pay for all those, anything related to their diagnosis or comfort meds.
All right. And that's signed by Nurse Pippin. Is that right?
Looks like it. Yes.
Also signed, I mean, you recognize her signature, right?
Yeah.
And that's also signed by Dr. James Michael Schuyler.
Yes.
And you weren't involved in her care until the 23rd, is that right?
Correct.
And then I'll show you what's been marked as Exhibit 10 to your deposition. Have you ever seen this document before?
No, I haven't.
This is a Georgia CVS Pharmacy. Do you see that at the top? LLC.
Correct.
Store number 07782, patient prescription record,
Okay.
which covers June of 2017. According to this document, Dr. James Shiver prescribed diazepam 5 milligram tablet. Do you see that?
I do.
That was filled on June 22nd, 2017.
Yes.
Quantity dispensed 15.
Yes.
And what type of drug is diazepam?
Anti-anxiety.
And then beneath that, do you see fentanyl, 50 micrograms an hour patch?
Yes.
According to this document, that was also prescribed by James Shivers, MD.
Correct.
And that was filled on June 6, 2017.
Correct.
Objection. Mischaracterizes the document.
Okay. Sorry, June 22nd, 2017.
Yes.
Thank you.
22nd. Sorry.
And the total, I'm sorry, I didn't mean to interrupt you. Yep. And the quantity dispensed was 5, is that right?
Yes.
And then hydrocodone, acetaminophen, 7.5, 325, also prescribed by Dr. James Shiver.
Correct.
That was filled on June 16, 2017.
Correct.
6.
Correct.
And hydrocodone, acetaminophen, 7.5, 325, again prescribed by Dr. James Shiver and filled on June 20th, 2017.
Correct.
That was a total of 30.
Correct.
Then lorazepam, 0.5 milligram tablets, also prescribed by James Shiver.
Correct.
Yes. Filled
Correct.
on June 23rd, 2017.
Correct.
And the total number was 45. Is that right?
Correct.
And the morphine sulfate, 100 milligrams, 5 milliliter solution, also prescribed by James Shiver, filled on June 23rd, 2017.
Correct.
Total of 30 milliliters. Is that right?
Yes.
And would you agree that the medications or drugs that are prescribed for patient and hospice care should be included in the medication record for that patient?
Objection. Calls for speculation. Also calls for the incorrect standard of care for home hospice.
You may
Join.
answer.
Join.
Okay.
It's in the chart. It's part of the chart, but we don't have an MIR that we go by.
Yes,
In
ma'am.
home.
It's- Right. I understand. MAR is short for medication administration record, right?
Correct.
I understand that you don't have a document entitled medication administration record, right?
Correct.
You do have what's called a medication profile, right?
Correct.
And that medication profile includes the drugs that were prescribed or administered or both by hospice while that patient was in Homestead Hospice's care. True?
Objection. Objection to the extent it mischaracterizes testimony.
You may answer.
Yes.
So, I'd like to show you what's been, well, let me see if I can get this in here. Can you see that document?
Yes, sir.
This is a medication profile for Shirley Couch.
Correct.
And this has the drugs that were prescribed or administered or both while she was under Homestead Hospice care in June 2017?
Objection to form.
Give me an answer.
Yes.
Including what was in the home.
Comfort kit.
Yes, ma'am, the comfort kit. Thank you. We'll mark that as exhibit. Is that 9, Madam Court Reporter?
That would be 11.
Ooh. So, as exhibit number 11. Let me go ahead and give me one moment. I want to get a copy into the chat for everyone.
We also need exhibit 10 uploaded.
Say again, please.
We need exhibit 10 uploaded to the chat.
Okay. There. All right. I'd like to show you now what's been previously marked as exhibit 11 to your deposition. Have you ever seen this document before?
I don't recall.
Yes, ma'am. This is a Homestead Hospice physician's order for Shirley Couch dated June 20th, 2017.
Correct.
And it's signed by Dr. Shiver, James Michael Shiver, MD.
Correct.
And it's a prescription for Norco. Does Norco have another name?
That was the acetaminophen it was on the MAR. I can't.
Yes, ma'am. Well, it was on that CVS document.
Yeah. But yeah, Norco is oxycodone with Tylenol, I believe.
Okay.
Objection to the extent it's calling for a pharmacological opinion.
That's fine. And it reads here that 30 tabs were prescribed.
Correct.
And if we go back to, is this exhibit 10, Madam Court Reporter, the medication profile? Or 9? Well, for the record, we're looking at the medication profile. Is that right? You see that page 1 of 5?
Correct.
And if we scroll down to.
So I'm confused. I think this one, the CVS one was 9. This one was, no, the CVS one was 10. This one was 11, and the last one should have been 12.
That's fine. So the 6/20/2017 Norco prescription signed by James Shiver is 12. And the medication profile is 10. Is that? Got it.
No,
So
11.
11. Hold on.
The one with all the highlighting from CVS, I believe, was 10.
Okay, so that's the CVS. All right, and 12 is a Norco. All right, I'm taking you back to Exhibit 11, which is a medication profile. Do you see that for Shirley Couch?
Yes,
Page 4 of 5.
correct.
And do you see, it's going down to page 5 of 5. Well, page 4 of 5, do you see the last prescription was a Norco 7.5 milligrams, 6 by mouth every 4 to 6? You see that?
Yes,
PRN. And then do you see the next one is 622 fentanyl microgram, 50 microgram patches every 3 days for pain?
yes.
So I don't see between 615 and 620 the Norco that is Exhibit 12 for the 30 tabs that was also billed on the 20th according to Exhibit 10, which was a CVS document. Can you tell me why those 30 tablets are not disclosed on Ms. Couch's medication administration or profile and
On
her
the-
medical record?
Objection calls for speculation.
You may answer.
Wayne,
All right. The med profile is simply any medications that, you know, she's might have or in the home. But the other one is the actual order where it was ordered from the pharmacy because they had at that time had to have hard copies. So this is the actual
Right.
order that went to the pharmacy.
Yes,
And
ma'am. So the medication, I'm sorry, I didn't mean to interrupt
And
you.
the medication profile, it just lists she's taking Norco.
So the medication profile doesn't necessarily include all of the drugs that were
It doesn't include
ordered.
the amounts,
Doesn't include the what?
like 15 or 30 mLs. It just the medication and the order that she has for the medication.
Okay. Show you what we'll mark as Exhibit 13. Let me go ahead and put this in the chat. Do you see that?
I do.
So this is what looks like another physician's order, see up in upper right for Shirley Couch.
Correct.
And this is sulfa and codeine. See where it reads 623.17 in the upper left corner?
Yes.
Morphine, 20 milligrams per milliliter.
Correct.
Dispensed 30 milliliters.
Correct.
And you remember this was dispensed according to that CVS document that I can pull up again, but you remember that a moment ago?
Yes.
Also on the same date, the 23rd.
Yes.
And if we look back at Exhibit 11 to your deposition, which is the medication profile, you see where it's Valium on the 22nd, morphine again on the 24th. That's the start date. There's nothing there for the 23rd. Is that right?
This was the new order, the 0.25 to 1 mLs on 624. So on the previous page, Go to page 4.
Okay. Yep. Right here.
There's the Norco.
Let me go back again.
Yeah.
You want me to go all the way to the top where we've got the
No.
comfort kit?
Yeah.
Okay. Go.
There it
How about
is.
the-
2.
Yep.
Wait a minute. Yeah, 6-2. Where did it
Oh,
go?
still missing
Went
it.
too far.
Sorry, go ahead. Yep.
Go to page 2.
Okay. Right here.
That's the order right there.
You see my cursor there?
Uh-huh.
Yeah, the second entry on that page, the morphine. All right. So your the medication profile will have the drugs that the patient is being administered. It won't necessarily have the amounts or the dosages or when those drugs were ordered or taken off. Is that right?
Correct.
I think we're closing in on this thing. My guess is nobody's happier to hear that than you. Oh, certify. Do you agree that Shirley Couch was an opioid naive patient?
Objection, calls for medical opinion, calls for pharmacological opinion.
You may answer.
Join.
Yeah. I don't know.
All right. Renee Bonner was employed by Homestead Hospice the entirety of June 2017.
Yes.
In your education experience and training, have you learned about potential drug interactions with opioids and benzodiazepines?
Yes.
And have you learned that those are potentially dangerous?
Objection to form.
All medications can be dangerous, so yes.
Yes, ma'am. And my question's a little different though. The administration of both opioids and benzodiazepines at the same time can be dangerous for a patient.
Object to form.
Objection form.
No,
You disagree with that?
I disagree. We
Okay.
do it all the time.
Okay. You agree that while Shirley Couch was in Homestead Hospice's care, she was administered morphine and fentanyl and Valium and Norco and Haldol and lorazepam and tramadol.
Objection, calls for speculation.
You may answer.
The only ones I know that she was actually given were the ones that I saw, which was morphine, Ativan, and the fentanyl patch and the Valium.
All right. And who applied the fentanyl patch?
I do not know.
And how many fentanyl patches did you see on Shirley Couch?
One,
All right. Where was it located?
her left side, left thigh, leg.
Now, Shirley Couch's nurses, in addition to yourself, were Ashley Mercher. Is that right?
Objection,
Mercer?
calls for speculation.
I don't know. All of our nurses would have been her. All of our patients belong to all of our nurses. So
Do you recall an Ashley Mercer?
I know that she worked there. Yes.
You don't know what other nurses cared for Shirley Couch, though.
No, I do not know which all nurses saw her.
But Renee Bonner in June of 2017 was the office manager and administrative assistant. Is that right?
I don't know what her exact title was. I don't know what her exact title was, but she was the main human resource assistant, I thought, but I don't know her title. But it was administrative.
Yes, ma'am. Do you know the name Taiwo Sabamowo? Does that ring a bell?
No, it doesn't.
Were you aware of a Homestead Hospice nurse that was arrested? Well, not a nurse, a woman that was arrested for pretending to be a nurse while employed at Homestead Hospice?
Objection, cause for speculation, relevancy.
No, I don't.
All right. Show you what's been marked as exhibit 13. Is that right?
Objection to this exhibit lacks foundation, relevance, speculative.
You recognize this woman?
No, I don't.
This was someone that was masquerading as a nurse that was also employed by Homestead Hospice when you were employed there.
Objection, foundation, speculative.
You may answer.
I don't know her. Don't know anything about her.
That's all I have. Thank you.
I'm not going to have any questions.
Nor do I. I'll order an E-Tran along with all exhibits.
I'll do the same.
And we are reserving signature, please.
We're going off the record at 2:28 p.m. James, are you still there?
Thank you.
Yes, I am.
So the
Connect.
last exhibit I have that I could download was exhibit 11.
Okay. Have you got 12 and 13 now?
I do not, and you uploaded something, I don't know which number it was, but I can't download it for some reason.
Well,
Was
what's
the
your email
cut.
address? If you tell me which ones you're missing, I can email those to you.
I need everything after 11. I got through 11.